go ahead and get started, and I can.
Thank you. Hello, my name is John Baker. I'm an assistant chief for fire department. Chief Grunison sends his apologies. He had scheduled an out of state visit and wasn't able to attend, so I'll be presenting for him.
Good morning, James Sturdivant, Fiscal Officer for the Kansas City Fire Department. So our submitted budget for the FY 25-26 fiscal year is $321.5 million. We are part of the public safety citywide business plan goal, and that total is $688.3 million.
So looking at some of our KPIs, we received into the 911 Communications Center for our side, for fire side, 313,000 calls last year, of which we had dispatched calls of 137,000. Our average response time for first arriving unit from first keystroke, which means when the dispatcher actually enters the call into the computer, types in the first thing, is 6 minutes and 35 seconds. 9 minutes was the old mass standard that they wanted to make sure we achieve. So we're well under that for all life-threatening emergencies and basically all emergencies. So our overall cardiac arrest survivability, last year we were at 11.5%. The national average is anywhere between 5 to 10%. We consistently, with our crews and with our people, are above the national average on the cardiac survivability rate. The other one that we're really good about is our push for bystander CPR and hands-only CPR. We do a lot of education with that. We are at 57.5% of that, of them actually doing a CPR and AED, which is the automatic defibrillators that are out there, them being placed and in use. We're at 57% and 11% respectively. The national average is 40% for bystander CPR and 3 to 7% for use of AEDs. So that's another thing, a big part of our public education. We really push hands-on CPR, hands-only, which helps the public a lot. A lot of people are resistant to do the breathing, but everybody's more than willing to do the compressions, etc. So we are rated at 73% on the satisfaction survey. The new airport beat us out for one of the first times ever that we weren't rated highest in the city. So that is one of our goals, to overtake the airport next year, and we plan to be back at #1 where we belong. So we had 13,362 inspections of businesses and apartment residences in the last year also.
All right, so as you can see, our adopted 25 budget was $275,804,147. We submitted for FY 25-26 $321,536,809, which is an increase of $45,732,662, which equates to a 16.6% increase. As you can see, emergency services makes up 64% of that total, with operational services coming in second at a 23%. The $45 million is roughly made up of $33.9 million in personnel services, $8.1 million in our contractual services, and $3.7 million in an increase for debt. The personnel services is primarily driven by the new local 42 CBA, with the increase in wages and specialty pay. Our $8.1 million is primarily driven by, we have roughly $600,000 increase in excess workman's comp. We have increase in legal claims by 1.3 million, and miscellaneous 5.9 million in enterprise software, auto equipment repair and maintenance, and auto liability claims. The debt increase is primarily due to the fact that we will be servicing new debt for our arrival of our new fleet pumpers and new ambulance, our last ambulance tranche that we will be receiving this year. So, all right.
So here are some of our major changes coming up. So we're launching the First Responder Career Exploration Program for high school students. We already have that in place. We currently service Center High School, which also includes the Hickman Mills and Grandview area. We also have Manual Tech, which encompasses all of the Kansas City area. And we're currently working with the Northland Career Center, who is a new, they're actually not new, but they're building a new facility off of Platte Purchase and I think 152 up there. And so we're working with them. So we're basically encompassing all the way across the city from the north to the south. This is basically a program for high school students who might be interested in public safety careers. We encourage them to look at, fire, obviously, and we give them some basic first responder training. The Northland Career Center is actually going to offer EMT and Fire 1 and 2 as options for testing. We do such things as we help them if they need somebody to come up and assist them with any of the drills that they might be doing, excess equipment, like we recently have just taken all of our hose and we've replaced all of the hose on our fleet, the fire hose, and all that excess hose, the old hose is still usable. We're making that available to all these programs for them to be able to use. So those are the kind of things we do. We're also very proud that we have the first fire cadet in the academy this year that graduated from the Center High School program. So this is a recruiting tool for us, and it's starting to show fruit because with this, like I said, we have our first recruit that's out of Center High School, the program there coming through. We will be replacing 11 new pumpers to complete the 1-year life cycle. It'll be year to year. We'll slowly replace the entire fleet. And we've completed 2 station remodels that are gender neutral facilities. Station 30, which is down on Prospect, 70th and Prospect, right in that area. And Station 47, which is now next to the Fire Academy. We have 2 more scheduled for next year. That would be Station 44 and also Station 17, which is in Midtown. Station 34 also is being completed. They're all moving in. That's up north off of Parvin and 35. And they'll be moving back in next Tuesday. And they'll have gender neutral facilities also. We've initiated a new contract with AP Triton for a new strategic plan for the department. It includes a new standard of covered and community risk assessment. And we expanded our drone program and formulated strategic partnerships with the NFL to provide drone coverage during the Kansas City Chiefs home games. First fire department in the nation to be able to do this. We're the only fire department in the nation that has this program with the NFL. We're the only ones that are allowed to fly drones at any NFL stadium or venue. So I'm very proud of that ability. The new 5-year collective bargaining agreement with Local 42 is a major driver of the increase in personal services, as James stated. We've hired 47 new uniform positions, including firefighters, paramedics, and call specialists. We currently have 67 cadets in the academy that will be graduating around July to August, somewhere in that time frame. We were awarded $1,677,000 in federal funding through Assistance to Firefighter Grant, AFG. That's how we replaced all of our hoses and nozzles throughout the fleet and the department. And we have newer equipment that updates suppression crews to operate. It allows them to, it's called low pressure hose. So instead of, we're at a lower pressure that we're pumping that at. It's easier on the equipment. It's easier to maneuver the hose and for our crews. We finally are acquiring our last installment of 12 ambulances. So if you all look out there, the old air ambulances are all white. The newer ones are all red. This will complete our last tranche of the final set of new red ones, so all of our first line should all be the red newer ambulances. We're still keeping the older ones for the upcoming World Cup because that's just they have plenty of people, but we don't always have the equipment. So we're going to be keeping quite a few of those, so they'll still be there as reserves, and you'll implement a lot of those on the World Cup. After that's done, then we'll probably transition them out to other use or sell. We've launched the KCFD Paramedic EMT program that used to be housed under UMKC. I believe we're the only fire department in the area that has its own paramedic EMT program. Paramedics are the golden ticket for firefighters right now. It's a shortage nationwide, not just for fire departments, it's for hospitals, everybody. We've run over 50 of our people that our firefighter paramedics have run through this program. We're now taking it over so that we can allow unlimited. We used to only have so many seats because UMKC would have the rest of them for the public. So what we're going to do is this will allow unlimited seats for our people if they wish to go. We'll still have excess, and that we will still be able to have people like other people from the public could come in. That's another recruiting tool for us. So if they go through that and they're interested in fire service, this is a great way for us to transition them because they're working with our people, they're riding on our ambulances and our fire trucks and seeing our people, and we're our best recruiters once we get them out with us. So, and one of like I said, one of the 7 fire departments in the nation with a thermite robot in the whole United States. The thermite robot is basically it's about the size of one of the cars, the little tiny cars, but it's completely remote. It has the ability to throw water, and it also has thermal imaging as well as a regular camera. So we can send this into hazardous situations, whether it be a hazmat situation, a large warehouse, or say especially like around here we have tons of caves, which is one of our most dangerous situations for our firefighters. We can send this down in there. Not only can we evaluate and see what's going on, we can actually have the ability to start mitigation with the ability to throw water and et cetera like that. And it's all available to be remote operation. So it's even strong enough that like if we're trying to get to somewhere, we can push cars, small cars or, not big trucks, but cars and stuff out of the way with this to clear a path for us to be able to get into it, so. Sorry. So our alignment with the citywide business plan is we enhance employee recruitment and succession planning and retention in the police and fire departments with continued emphasis on diversity. We do have a diversity officer and a captain that are in that specific that are addressing and looking at all of our policies, procedures, et cetera, to make sure that we're all in alignment with the city policy of diversity and equity and inclusion. We maintain a level, like I said, a DEI, internal DEI office considering of a division chief and a captain. Once a month, we work alongside 3 separate consultant groups creating a DEI work group. And we continue its participation in all parades and in most events within the city and the Kansas City region.
And here's just what Chief Baker spoke about earlier with our resident satisfaction survey. And from this, you can see that both for fiscal year 23 and 24, we've either equaled or are above average in comparison with other larger cities throughout the United States on how quickly we respond via EMS, how quickly our fire and rescue respond, our quality of EMS service, and quality of local fire protection and rescue services. Like Chief Baker said earlier, when I showed these results to Chief Grinderson, he was kind of taken aback the fact that we had been overtaken by the airport and that he has pretty much made it known that we will be back to #1 next year. So, and with that, any questions?
All right, are there any questions for fire? Mayor Pro Tem? Councilman Curls.
Okay, I'll lead us off. Thank you for your presentation. Thank you, Madam Chair. I have a couple questions. go back. I know, and I was a little tardy in getting here, so you may have covered this, and I apologize if it's redundant. But on the completed stations that you've got, gender neutral, I know you said you've got 2 completed, 30 and 47, completing 2 more, 44 and 34. Where does that leave you, or if you have any more left to do, and how many more is that? And what's the plan?
Yes, we do still have a few left. I believe we're within the range of, I think it's, I want to say 6 to 8. I don't know the exact number. I can't get that number to you. Our limitation on those is with the city construction companies. They're basically, we can hit like 2 a year to get them redone. And so every year we have it planned out to hit all the stations to get them all done, and completed. But we're working as fast as they can get the construction. As soon as they get done with another one, we start to the next one. So our basic limitation, we have the money budgeted in our plan to finish all the stations. Our own, like I said, our main limitation is we have to work through the city general services and their contracting, and we can generally work on the average of being able to get 2 stations done a year.
So at that rate, you might not have all of them completed for 16 years, and if you're doing 2 a year, you got about 8 left?
That would be I think the plan is set at 3 years. That would be, if 2 a year, if we've got 8 left, that's 4 years at the most.
All right, maybe I misunderstood, okay.
Uh-huh.
And then what about fire protection equipment for your firefighters? Is there anything in this budget? How are you set on that for your firefighters in regards to equipment and stuff that they may need in order to help them do their job?
That's a basic budget line item we always account for. We have maintained a certain amount. We're actually going back to reevaluate the bunker gear, which is the outer gear that they all wear. That's going back to our technical services committee to review that and see what else is out there now and do some testing to see if we want to change vendors and all. And if that happens, then we would move forward with replacement.
Okay, now, just a couple more questions. One more is your class of cadets. You've got a class currently now of 68.
67 now. We lost one the other day.
Okay, and then you got another class coming on, or do you know?
The plan is as soon as this class gets out, we generally take about a month to rehab, have our people refresh, and then within that month, we start another class.
And the process on that, do you take people that have currently applied and you go by the score, and do you go continually down that list, or do you start all over with a new list?
We're conferring with HR, the city HR department, who ran the hiring process for us. The fire department, we were hands off on this last hiring process. We just got the list from them. My understanding is they intend to go from that list and start and go forward from that, but it hasn't been determined yet, I believe, whether they're going to retest or not. That's a meeting that we're planning on here probably in the next month or so to start getting ready for that next class coming up.
Okay, and you got an idea when that might be, the next class?
I would say probably around November-ish, right around there would be my guess.
Okay. And then my last question is on DEI. With the current administration's directive on DEI, how is that going to affect you? Is there some type of budget concern that you might have with these work groups and stuff that you have established?
Concerns about?
No.
I mean, is there any funding? I mean, obviously the administration is saying they want to cut out DEI and do away with all those programs and stuff. So you've got
Are you talking about the federal administration?
Yes.
Oh, that.
Yeah, I'm sorry.
This is an in-house program. It's in-house and funded through us, so there's no worry about that. We're just, like I said, we're reviewing our policies and making sure that.
Yeah, but they're mandating cities and states and everybody to cut it out. The governor did not.
We haven't received anything along those lines. We will continue, and as directed through the city manager and the city council until we're directed otherwise.
Okay, thank you.
Okay, thank you, Madam Chair. Just along that line, I'll just state, you know, that this body has not had any requirement or made any changes to our DEI, to the DEI program. So I'm glad to hear you say you recognize that, you know, this body oversees that for Kansas City. And so if there happens to be a letter or anything that comes forward, I'm sure that it'll come to the city manager and that we would hear about it, and then we would
Yes,
offer
yes.
whatever policy for the city of Kansas City that needs to be done. So just want to reiterate or just state that. So first of all, just want to commend you all on your fleet management. I actually referenced it yesterday, as I definitely have concerns about fleet management throughout the rest of the city, and referenced your program, which you mentioned today in your presentation.
Yes.
And how you are managing your fleet. And I think that is a very effective way for us to ensure that we have adequate fleet to allow you to, you know, provide your services. So thank you for your leadership on that. And I'm hopeful that we'll be able to institute similar life cycle programs across the rest of the city that will be just as effective. So I would like to talk about on slide 6, and I was listening online, but also transitioning inside. So if you covered this already, I apologize for that. But can you provide more insight on your KPI, the overall cardiac arrest survivability? Can you just provide some, elaborate on that, please, kind of what that is and how we are?
On the overall, are you,
Yes.
on the
and-
KPI? On that?
Yes, on that cardiac arrest survivability.
Yes. So what that is considered is a cardiac arrest is basically, people don't realize that basically you're dead. You're not, there's no breathing, there's no, you know, or I'm sorry, you could actually have some respiratory residual breathing, but there's no cardiac activity at all. That's when you would apply an AED, or as we have defibrillator monitors that we would apply ourselves. And what that is that is somebody who attends ROSC, which is return back to spontaneous breathing. There's a difference that they reach to that point. A lot of people reach ROSC, but when they get to hospital, they don't make it past that point. The survivability is somebody who actually generally is somebody who had a cardiac arrest, had interventions, and makes it out of walks out of the hospital, or becomes, you know, makes it out of the hospital alive. Was
And
that
so
your
the
question?
target, so I don't equate that to the target.
The target was 7.5%. The national average for survivability on that is 5 to 10%. We generally average around where we're at now, 10 to 11%. A lot of that is just medically, it's not survivable. I mean, a true cardiac event, the ability of a survivability of that is relatively small.
So ultimately, so your actuals in 2023 to 2024 was that 11.5% of those who had cardiac arrest in this range survived.
Yes,
And
yes.
so I guess my question then is, if you've achieved 11.5%, because higher is better.
Correct.
So then why would you have a target of 7.5% if you've achieved 11.5%? Why wouldn't you have a higher target?
We basically shot for the middle of the national average. We basically, we could shoot for a higher target, I guess, if you wish. We could push it up.
And you said national average is what?
5 to 10.
So that is above the national average. So you're
Is where
really
we
double,
hit,
you're more than
yes.
double what the national average is, which is commendable. Yeah, but I guess still, if you were, I mean, I don't know, to me, you know, always, you know, I believe we should always strive to do, you know, to continue to improve. And so
Right.
if you've already beat the national average, I just don't understand why you wouldn't aspire to continue, to beat that.
Right.
How long has your trend been above national average? Was that a
Well,
one-time thing?
the national averages change every year with different advancements in medical technology, et cetera. We generally do exceed the national average just due to the skill of the medical professionals in this area and our people. And the biggest thing, a lot of it is the rate for bystander CPR ties directly into the survivability rate, because early defibrillation, early CPR are two of the main factors of a survivable cardiac event. And so that's why we keep pushing that. Like I said, we can definitely increase and push that up. That's not an issue with us.
Yeah, I guess we
So-
just consider, or just ask you all to consider, looking at it and seeing if you all can, continue to strive to do better.
Well, we
to
always
improve that.
strive to
Yeah.
be above the national average and try to be the best, if not just the area, but the state. So also, I mean, that's a constant goal within the department. That I don't know
So
exactly how
moving
that
it
number
wouldn't
was
be
arrived
a
at.
big deal then? Okay, thank you for that. I also wanted to talk a little bit about the 911 call time, and I know that with the process is that the calls first go into KCPD, and then they will transfer those calls over to you all. And last year, when we had some discussion about this, we talked about how you all track which you don't show it in these KPIs today, but how you all track, because you all use NFPA, I believe is the standard, that's the National Fire Public, I forgot what it stands for.
We follow the emergency dispatching protocols. It's a national standard for us, yes.
Okay, and so the requirement of having 90% of calls answered or responded or answered within 15 seconds. So last year when we had this, I know there was some data that was presented. You all were tracking your data from the time that you all received the call, but we weren't getting, from the total, the total cost from the start of the initial call, and it was the data was segmented, and I believe I had requested that we make sure that we track that total time so we could actually get an accurate reflection of what the total response time is or total answer time is. And I want to know if you all made that transition in the data that you collect. In this last year, has that been changed, or are you all still only calculating the time from when you actually first received the call?
I know we have the time that from when we received it. I can get a hold of our communications deputy and find out if they have gotten that information from PD. That's where we would need to receive it from them to say, this is when they received the call. And I can get that information to you. I don't know currently if that's how it's being calculated.
Yeah, I know there was some discussion with Mark because they maintain that data as well. So can you just get the information to me? I would like to see what has
Yeah, I got
transitioned
it.
from what's improved, what's changed since our discussions that we've had over the last year. As obviously we know those, precious seconds count. And so just want to make sure that we're continuing to push ourselves to improve that as well. And then finally, I wanted to ask so if I recall correctly, I think based upon the CBA, you all are not required to have the salary savings. Is it different for this department?
It is different for the fire department. So the fire department, the budget is built with a 3% vacancy rate versus the rest of the city at 10%. And that was based on terms in the collective bargaining agreement that anytime there's a vacancy, that we'd start new classes to ensure that public safety officers could be hired. So that is why fire is different.
And what is the vacancy rate?
So,
currently?
Currently, HR, when I checked with them the other day, they say we're at a 6% vacancy rate, but the majority of those vacancies are firefighters, paramedics. So with this new class, once it's complete and we fill those vacancies, we'll be down to less than 2%.
Okay, I think that's all my questions. Thank you very much. All right.
Councilwoman Robinson.
Thank you so much. And I was listening online, so thank you for your presentation. Your KPIs, are these all of your KPIs, or are these just a portion of them?
This is just a portion. This is what we highlighted with the city manager.
Okay, thank you. So do you have a KPI regarding EEOC complaints?
I don't know that we do. That's the EEO complaints, that would be from the EEO office, and they would have that, that information. We don't house that information ourselves.
Okay, and so with that, I know part of the council's inquiry regarding making sure that our fire stations are, and our fire service, and our entire city, is not just the fire department, right? That our workers are being treated well and have an environment, a healthy work environment. But because the fire station is different in terms of people living in those environments, we have really kind of zeroed in on what's working and what's not working. And so how does your budget reflect, other than some of the technical fixes, which are the bathrooms that the gender neutral stations, all of the great work that you guys are doing there. I want to acknowledge you for that. And I think I heard, now when will are those all completed, or when will they all be completed?
We still have some of our stations that we still have to complete. I want to say it's within the 6 to 8 stations. I can get the exact number from you, for you, and have that by the end of the day.
Because I did.
I believe, if I remember correctly from talking with our facilities manager, we're on a track, like I stated earlier. We are, with the construction and the general services people, the contracts we have to use with our construction people have to do, we can do roughly 2 stations a year.
When will they be done?
I believe that it's projected out that it should be, I think it's like 3 years, right around
3 years from today.
To have all the stations, yes, up to gender neutral.
Okay, so can you send us some information about like how we can expedite that? What would be the drivers to, and that's not something that I'm asking.
I can tell you right now, if we could move funding, because we funded at roughly 2 per day. It's general services. We only have certain contractors that we're allowed to use. And so we use them, and then they don't have the capability to do more than that, basically.
So if we fix some of the contracting issues to allow us to open up, to allow for more contractors, we can expedite it.
Yes, so we could. We would also then have to, make some budget amendments also.
Okay.
But yeah.
Can you send us a memo or some communication about that before this time next week?
Sure.
Okay, thank you. And just to build on that, you've done a great job. We've done a great job collectively to address some of the technical issues. But I am concerned about some of those adaptive challenges that we're having as relates to inclusive diversity and equity and inclusion. So you'll probably hear that more at the local level now. But how does this budget reflect the fact that we're working on some of those adaptive challenges? Because we still, when we're talking to firefighters, a lot of them are saying we have a ways to go there. So how does this investment reflect our leadership in that area, other than the technical, changing the bathrooms and changing the living stations?
We have, like we had stated earlier, we have a DEI
Yeah, I heard the
office and
captain, I heard all that.
and a division chief on that
Yeah.
are constantly
people.
reviewing our policies and other things that happen, just daily activities, and bringing to light any issues that or potential issues that they see, whether real or perceived, and ways that we can maybe address it to alleviate those issues as needed. And it's a permanently funded position, so they're there all the time. We actually had a 2-hour meeting yesterday with those two, and then a group of other leaders within the department, we're reviewing our vision statement, our mission statements, all of our policies, et cetera, to make sure that they're in line with the DEI.
Okay, so there's no budget considerations that we need to, other than the positions and the people, which is a significant investment that we need to consider to address. We don't have any budget.
No, because
Okay.
any, like, if they wanted to bring in a speaker or do an education piece, we would consider that training, and that would be coming out of our training budget, so it's already budgeted, it's
Okay.
within the budget already.
Awesome. Okay, so can you talk a little bit about the medical costs for unmanaged chronic illnesses? And are we analyzing any cost savings? If people were having better health care, then the ambulances wouldn't be called to address issues that could be addressed in the primary care facility.
So we have our community medic program is basically what is addresses those issues for us. We have 2 medics that are assigned to that full-time, plus a division chief that oversee it. They basically are there for people who have chronic or ongoing medical issues, and we work with them to align them with hospitals, state and federal facilities, and
How many
hospitals.
people? How many people are we seeing in that program?
I
Can you
don't
get it
know
to
the
me?
exact number
Okay.
off the top of my head. I
No
mean,
worries.
I can get that for you if you wish. They basically, what they do is they work through our department, our personnel that come out, and they say, hey, I just ran this person at blah address, and they are, 70 years old, and they're homebound, and they have all these issues, and is there anything that, they'll turn them over to them, and they'll help them try to find resources to accept or help them. Or we might have somebody that, say we have somebody we're running 10 times in a month, or generally it's more than that, it's usually like 20 or 30 times a month. And we'll turn that over to them to see what kind of issues there might be and some sort of solutions that we have. They basically aren't people who are needing hospital care immediately or anything like that. They just need services of some kind or some assistance,
Okay,
out of hospital assistance type
So
of
can
stuff.
you let us know how many people we're seeing in that program,
Mm-hmm.
the cost savings that are associated with it, and if there have been any thoughts of if there's a need for expansion in terms of us having 2 people that are working on it? That would be very helpful.
Okay.
And then you mentioned hands-only CPR when we
Correct.
were talking about our ability to impact our rates, our excellent rates regarding people who go into cardiac arrest. And you also mentioned that you're keeping some vehicles for World Cup. We need about 100,000 new people trained in hands-only CPR.
Correct.
And we need you to do the training. And so can you please let us know?
So what we do, the way we do this is like we did all of entire City Hall last year and came and trained
Yes.
everybody here. Every time we do a public event, recruiting event or anything like that, we also include that in there as a component of it for anybody who's there to.
Everyone's asking, how can they help with the World Cup? That's one way that they could help with World Cup. And imagine
Yes.
if we had several weekends of KC Live filled with people learning hands-on CPR.
Yes.
We need you to do that. We need you to take leadership, and we need you to help us get that done. Can you let us know what that would look like, and if there are any costs that are associated with the fire department taking on the leadership and getting that done?
Yeah, I mean, the way I would envision it is.
You don't have to tell me right now, because
Okay,
the chair
yeah,
is
we can-
giving me the death stare. Just send us, but because I do have another question.
We will get a plan together for that, and we'll
Okay.
be able to do mass training for whoever needs to show up at no cost to public.
Okay, 100,000 people, Kansas Cityans. Okay. Now, the other thing, because you all won't be available to take those calls, you'll be doing other things when the World Cup comes. We need people to be trained in CPR, hands-only CPR for the World Cup, okay? All right, so last question. around, and I had this question written down. I see President Craig in the audience. It was already on my paper before I came in here, so she's come to every budget hearing talking about these dumpster fires and what's going on in the Northeast, and so I did plan to address that today. So tell us a little bit more about the what's happening with the fire department and these dumpster. The people are making fires to stay warm, and it's causing vacant buildings to be burned down. It's concentrated in one area of our community. How are we investing in preventing these? And what do we need to do to make sure that, especially we have a hot spot in the Northeast and other places that have a concentration of vacant buildings. But residents are saying that they're calling, and I remember one that was on right over the bridge off of 18th and Benton Boulevard. And they were there, they had a dumpster fire going, and they're like, no one would come because that's not something that, like, you can't come put that out, is what we were told. So how is the fire department responding to residents who are saying that this is gonna catch a fire? People are starting fires and we need these to stop.
So myself and Chief Hopkins met with the Northeast Chamber of Commerce just yesterday afternoon, and we're talking with them about some possible strategies moving forward. There are some code issues, and as far as if you're talking like somebody who has a warming barrel, there are ordinances that allow a warming barrel at certain temperatures, and for a humanity issue, as at some point, we don't feel that when it's below freezing, and this is the sole means for this person to be staying warm, that it is advantageous for us to extinguish that when they have nowhere else to go. We do explain to them, hey, you need to move it away from this spot or do something else like that. And like I said, there's multiple strategies that we can address. It would really kind of get in the weeds, but it's basically going to have to be through code enforcement. For a vacant building, the fire department does not have enforcement capabilities for that. That would be a codes ordinance. They can go in, and especially for like a private residence, we can't just go up and they said, hey, there's a vacant person living in this house. We can't just.
Starting a fire, you can't go in?
If there's an actual fire, yes, but we can't just go onto the property and we can look through the windows, but we can't, like if it's boarded up or something, we can't enter the structure or anything like that unless we see actual smoke or a fire or something like that. There's still private residence rights, and whether they're here or not, I mean, we can't just walk into somebody's house just like we couldn't walk into your house to check to make sure that you're not illegally burning something. Technically, it's not legal to burn anywhere in the city. No, any non-organic things at all, technically. You are allowed a fire pit. There are stipulations to that, to where it has to be as far as distance from houses, et cetera. So there's all those kind of things, but it's basically to address something like that, it's going to be and it's mainly within the vacant structures. It's going to be something that's got to be addressed through code enforcement and some other things. I'd be happy to talk with you later about our conversation at Northeast, some ideas that we have, and we're planning on having some other meetings, and they had talked about having council there or the representatives there with us so we can all work together to try to address some of the issues.
Yes, because if we're having multiple fires in multiple locations in an area, it seems like we need to come up with some policy decision.
And during the wintertime, it's true. It's not just the vacant structures. It's all around everywhere. It's because people are trying to stay warm. They overload outlets, et cetera, in their own houses, and they have issues. Our tendency to have our fire calls go up over the cold times, and they tend to slide down a little more during the summertime. It's just a fact of the cycle of how things work. But yes, it varies. Sometimes it's in the Northeast, sometimes it's Midtown, sometimes it's on the west side. It just kind of depends on where the vacant housing is. That's kind of a migrant population, and they move to wherever the availability is for them to be able to get out of the elements, basically. And
So could you, after budget season, put together kind of a map or some sort of data around how the entire, like what's happening across the city regarding fires where people are trying to stay warm, whether it's fires that you have had to put out, like structures because it's a threat to human life.
Actually, the Northeast News published on their last publication.
But what, yeah, we saw
They
that.
had
But,
that would be that. We could do citywide too.
yes, that's what I'm saying, because it sounds like what you're saying is that it's happening all over, and the council needs to understand that data and what's happening, why it's happening, if there's needs to be any policy shifts to prevent, because especially if it's inside structures, and people have the electricity on and it's happening, maybe it's, providing electrical heaters or something like that. I don't know what it is, but it sounds like there's a policy that needs to
Generally,
be.
in most vacant structures, all utilities are shut off.
Yeah, the vac- I
And
was
so
just- yeah,
the
that's-
problem with the fire is they're starting an uncontained fire somewhere, and it gets they fall asleep
Yeah,
or
something,
pass
yeah.
out for whatever
Okay.
reason, and it gets out of control.
Thank you so much. We won't belabor the point, but we look forward to more information. All right, thank you.
Councilman Duncan.
Thank you, Madam Chair. I'll be brief. I think that my feelings about what the fire department is doing can be reflected with the survey that you have from our residents. I think you all are doing a great job. With that said, I want to uplift what my colleague said, Mayor Pro Tem. We shouldn't be setting targets that put us backwards. If we're hitting 11.5, we should be trying to either hit that or raise it. And I think that our residents deserve the best possible outcomes in every regard. And so while I will commend you on that 11.5%, we got to continue to do better and not go backwards. With that, I think that following up with what Councilman Robinson was stating about DEI and the culture within the fire department, I think when we look at a key performance indicator, right, we're identifying goals that we want to hit, and we got to bring up, if we're going to talk about the good, we got to talk about the bad and the ugly. And the bad and the ugly of it is that, the lawsuits are an issue, and the lawsuits are stemming from a number of issues, right? So what are our key performance indicators for the fire department in reducing lawsuits and creating a better culture within the fire department?
Well, the main issue for that is part of what our DEI division is addressing as far as the cultures and the way things are perceived. We've had several different times where they've gone out and given training to command staff, to firefighters, medics, everybody out in the field about just different things about the way you speak, things that unintended consequences from your words, that to be able to think more about how what you're saying is perceived, those kind of things. So it's mainly through education and training. I in my 29 years, all my time I've been there, I could care less who I work with. My main concern is how well do they do the job, and are they capable of doing the job? That's all I care about. That's all pretty much what everybody else cares about on this job. They don't care who they're working with. They just want to make sure that they have competent, well-trained individuals working beside them that can help them get their job done, their tests assisted. The other problem is that we're around each other for 24 hours. It's not an office setting. They're in basically what is considered almost like a home life setting. So there is a more relaxed atmosphere at some point in time to which people tend to speak more freely or more with less thought of what their statements are or their joke that they make. And they have to realize that, yes, you're still in a professional setting and you need to be thinking about what you're saying and what you're doing. You may not have an intended consequence. You may not be meaning anything bad by your statement or whatever, but you have to realize how other people may be perceiving what you're talking about. And so it's mainly an education process. And it's something we go on. It starts at the academy now. We have them, involved in that. That's part of their training there. We include that at every promotional level. We have an academy. We have a captain's academy for all our new captains that come through, a battalion chief academy for all the new battalion chiefs that come through, our WOC classes, and our new position that we're reinstituting testing for is for fire apparatus operators. They'll have an academy too. Every one of those incorporates part of that training into it, so that we are trying to get people to be more cognizant of what their thoughts or what their statements or their actions are, how they're seen by other people on the job.
But I hear that, right? And that's the 30,000-foot view of what we're trying to do. And to Councilman Robinson's point, right? That's a considerable investment in people and resources, and that's great. And also, we have to track our progress, right? So when we talk about key performance indicators, right? What is our goal? Is our goal, you know, 0 lawsuits? Is our goal, you know, increasing the satisfaction surveys among firefighters and paramedics? You know, what is our goal? How are we tracking our progress? And so when we talk about key performance indicators, that's what I want to see in a presentation like this, because I want to, again, I want to commend you all for the work that you do out in the field. And also, when we talk about unit cohesion, in whatever service we're in, whether we're police or we're fire, prior service, military, right? We have to be thinking about all of these things are interconnected, right? And if I'm, you know, black, queer, woman, non-binary, and I'm in the police force, one, we're talking about recruiting efforts, and we want to continue to recruit because we know we're on a cliff of folks getting ready to retire. So that's a public safety issue, and that's a readiness issue. Two, we want to talk about how are we able to respond to these things, right? We want to get these other key performance indicators down. We have to have better unit cohesion so people feel that the person to their left and the right, they can count on them, regardless of how they identify a sexual orientation or their race or ethnicity or religion or whatever. So it's not just a feel-good thing. It's about, this is real unit cohesion, and it's a public safety issue overall. So when I'm talking about key performance indicators, I'm talking about how are we tracking our progress in this field, because it's all interconnected. Does that make sense?
Yes, and I would have to talk to Chief Harris, who is over that department. I'm sure she's keeping track of a lot of those things that you're talking about and how our performance is, and I can have her get that information, either reach out to you or I can get that to you if you wish. I know that we've always are constantly expanding and looking for, you mentioned recruitment. We're looking everywhere we can to find people, you know, to come in that can do the job. And we don't care where you live, where you come from, you know, how you identify, any of that, male, female, it doesn't matter. We're just looking for people that can fill the job, because we need people. We need competent people that can work.
No, you're absolutely right, but I'm saying, you know, if I don't feel like if there's a public perception that the the fire department's not welcoming environment to work, then you can be everywhere you want to be, and you're still going to be buttoned up with that perception. So we're talking that's what I'm talking about, right? So right. All of these things are interconnected, right? And being in a public office, which I'm sorry you are, the fire department is a public service. Regardless of what we're doing internally and maybe what we know, that the perception sometimes is just the reality. So, you know, changing that perception means starting and tracking, right? Not just internally with the chief that's responsible for DEI, but at the highest levels, so that we can spread that culture from a top down. Is that track?
Yeah, no, and Chief Harris has weekly meetings with Chief Grunison over just those exact things and how our perception is. I believe the perception is changing. It's just like, I think, and the biggest performance indicator we can have is our recruitment and having people around our people and seeing how we really are with each other and how we interact with each other. I think that's our biggest selling point. We are considered one giant family. And just like everybody, family doesn't always get along, but they're all included and they're all taken care of, all the same. And I think that's our biggest recruitment tool. That's our biggest response to the public perception that, hey, this is, you know, I hear it's this way. Our people can say, no, it's not. This is how it is. And that's just a misperception by the public or by you, because you might have had, and I'm not saying there's not happens where there might be a bad experience, and we strive to have 0 lawsuits, as you said, or 0 complaints. And we work hard for that. But I mean, I'm not going to say that there's not going to be a time where somebody might not have a bad day and come across wrong. I mean, that's.
Well, Chief, I've read the lawsuits, so it's not a misperception on my account. I've read them, right? So I know what's going on, and those are the only ones that we've seen, right? So my challenge to you is that this isn't just a Chief Ross thing, right? You're the one giving the presentation. I'm expecting that we actually take a hard look and track our progress in these fields that we know is a challenge. So in future presentations, that's what I'll expect from you all. The other question that I have is regarding the increase in contractual services. It's looking like a 10 million increase this fiscal. Can you explain what accounts for that?
Yeah, so it's approximately 8.1 million increase in contractual services. Of that 8.1 million, 597,000 of it is for an increase in excess workman's comp. And then there was an increase of 1.3 million for legal claims. And then there was 5.9 million that was made up of auto equipment repair and maintenance, auto liability claims, and our budget for our software subscriptions that that in last year was left out that we put back in this year.
James, can you talk a little bit more what's behind those numbers for the legal claims, the auto claims, and the workman's comp?
I can get that information for you. I don't have it off the top of my head. This is, I'll have to get with budget.
Yeah, Councilman Duncan, I can share a little bit of information here. So how we build the workers' compensation budget is based on an outside report based on historic claims of what our potential or what our realistic view of what the upcoming claims would be for the year. And it's billed to the department based on what we see the history of claims across the city. We follow a similar logic for any type of general liability claim, auto liability claim. We allocate those to the department based on the history of the legal actions coming in against the city. So I'm happy to share that information with all of City Council so you can see what that looks like citywide, including the fire department.
Krista, is it like across the board? So it's not department by department, but a citywide analysis?
So it is a citywide analysis for legal claims. So the budget office puts that together every year with information from our law department based on the claim history. So we look at what working with our law department, what we think the claims will be for the upcoming fiscal year. And then those costs are allocated to individual departments because we want to show the cost of a program, the cost of running a fire department, the cost of running a municipal court or any department before you. So we allocate based on historical claim information, like the average over 3 or 5 years, what we think those department lawsuits will be for the fiscal year.
I'm asking, is it if there's an increase in auto claims,
Yes.
That spikes the overall city average, but they're related to the fire department, are we not focusing the allocation of when our budgeting for claims focused on that specific department, or are we doing it? Is it increasing it citywide?
Yeah, it is increasing in that particular department. So we want to show the cost of that program. And that's managed through kind of a behind the scenes. If you look in your budget, it's called an internal service fund or a consolidated fund. So we run a centralized legal claim fund, but the actual appropriation itself for those legal claims are in the respective department. So the fire department will have their anticipated costs of auto claims for the year, for workers' compensation. So we can really look at the cost of running each of these services.
And thank you, Krista. And Chief, this is what I'm talking about. So if we're having an increase in auto claims and workman comp in the fire department, that should be a key performance indicator in how we're going to get that down, right? Because that should be a goal.
And we do have a program in place that we're working on addressing vehicle accidents within the department. Part of that increase is because of everybody hates to hear it, the old supply chain issue thing, but the fact of the matter is we have issues with getting repairs done. The repairs have skyrocketed in the last 3 years if you've had to have any kind of auto work done at all. And we're working on big equipment. So unfortunately, whenever we have a repair, it's generally whatever you would consider for a regular vehicle, you can double or triple it because of the size of our stuff generally.
But is that I guess I'm a bit confused because when I hear an auto claim, I'm hearing that there was an accident of some kind. Is that not what that is? Is that not what I'm misunderstanding that?
I don't know I think the auto is, if my understanding would be repairs and stuff, not necessarily a legal claim against that. And a lot of the problems we run into is if we have an accident and it's not our fault, like we've had multiple times where vehicles impact our vehicles and cause damage. The people that are running into us may not have insurance or anything. We don't have any recourse we do try to go back and receive some money, for that damage, but multiple times we aren't able to recover any of that cost, and it's just we have to eat it, basically.
Chief, James, and Krista, can you guys get together and give me, and my colleagues, a kind of better, clear indication of what those auto claims are, those workman comp claims are, what is stemming that increase, so that we can better identify ways to, is it our responsibility? Is it something that we can fix internally, or is it an outside factor?
We will certainly do that, Councilman Duncan.
You bet.
Thank you. That's all my questions, Madam Chair.
Councilman Rea?
Great, thank you, Madam Chair. I have a comment, not a question, and I'm not necessarily looking for an answer or any kind of extended conversation, but I do think it is worth noting that I appreciate the investments into technology. The robot seems great, seems innovative, but I hope and I want to stress that we should be investing in our folks as well. I know that we've had some challenges with payroll. I continue to hear concerns about folks who aren't getting paid the appropriate rate or for the correct number of hours. I can think of nothing more frustrating than putting your life on the line and then getting your paycheck at the end of the pay period and it not reflecting, what you're owed for your work. And so I just want to make sure that we are prioritizing that we are coming up with a solution as we move forward. And then my second comment is I still have not received citizen satisfaction scores, and I want to comply with the March 5th rule that we have our budget amendments in by that point, and having those scores available to make my recommendations will be very, very helpful. I know we were getting some of that information with each budget presentation, but usually that packet comes with a whole lot more information. So those are my comments. Thank you, Madam Chair.
All right, thank you. Are there any other questions? Mayor Pro Tem?
Yes, thank you. I did have a couple of comments and questions. So I was going to ask about the fires. Councilwoman Robinson really provided a lot of information there and questioning there. But I just want to offer a suggestion that it may be beneficial for our multidisciplinary public safety task force to look at this, because the issue with individuals building fires in these vacant homes, I know is prevalent in a lot of our land bank homes. It's prevalent in, a lot of the vacant buildings. And I think that having a multidisciplinary approach or review could be beneficial. So for the city manager's office, just would like to ensure that we have, the multiple departments that are impacted to maybe look at this and then come back to some recommendations, to the council with recommendations on how we can, any policy things that we need to implement. Also, I'm reminded back when I was on the finance committee that there were significant delays in the billing. I believe it was the ambulance or the fire billing. We were significantly behind. You all weren't the ones that we were dealing with at the time, but I wanted to receive an update because you all had an aggressive plan to ensure that the back billing was addressed, and you look totally confused.
Yeah, I'm not sure exactly which building you're speaking about.
Okay, our finance director.
I can perhaps help with this. So the fire department and the finance department, we're part of the process to get a new provider for ambulance billing, and I believe one has been selected, and we're in the contracting process with the goal of improving collections and just that process in general.
Okay, so the finance department is overseeing the collections now?
No,
I mean,
we
I'm
are
sorry,
just-
the finance department is?
No, we're just working alongside the fire department to provide advice as they move forward with making these changes.
Okay, so are there vacancies currently in your billing, your fire, in your billing staff that are providing?
We have one vacancy in the medical billing specialist.
Okay, one vacancy.
Well, sorry, there's two. There's one medical billing specialist and a senior analyst.
And so how many staff do you have in this department that are providing in your financial services
In
division?
financial
Are you
services
talking
or
for billing or financial
Well,
services?
so maybe I'm calling it the wrong thing, but okay, so correct me.
I think you mean just the ambulance billing, how many people are in the ambulance billing unit, which is, there's a separate fiscal unit that James oversees all of it, lucky him.
Okay. Well, tell me both.
Okay, so I have 10 in the financial services division, which is like AP, payroll, and legal response team. And then in the medical billing, I have, there is, let's see, I believe I have 9 in that.
And in those, between those two, then, you have how many vacancies?
I have 2,
2 total between the two.
correct.
Okay, so am I correct to understand that you all have had some challenges or some issues with reclassifying some of the positions, maybe a manager position in this area that needs to be reclassified?
Not that I know of.
Okay, okay.
I mean, if I've been in this position for 7 months. I've been over,
Okay.
I've been over the medical billing for
Maybe this
about a
was
month.
prior to your time then,
Yeah.
possibly, but it seems like I remember there was, in part of the process, I think there was going to be some reclassification of positions, of a management position, I think, and then potential concern there. So just, I guess we can talk more offline about the details of that. I'd like to just ensure that we're continuing to move forward there. The other thing is I would like to request an update of where we are on that billing, because, I mean, we had significant issues and just want to ensure that we are where we need to be.
We can update you on that if you want offline. We can provide an update for you.
Okay, thank you. And then back to DEI, what are the strategies and how will this budget be utilized to expand any DEI efforts beyond what you are currently doing with additional staff training or any of that? Are there any plans in this year's budget to expand the work that you're doing?
As I stated earlier, the budgeting, for budgeting wise, it would be considered part of our training budget. And so that would be under Chief Harris and Captain Roberts, and whoever they will go on. They have a plan for either training and or bringing in speakers as needed and other things that they had planned on for that. I can have them reach out and give you what their the next fiscal year, their plan is on training or what other options that they're looking at as doing and bringing in for the department, if you wish.
Okay. I would like to see that. And then finally, are there, we've received concern in regards to the amount of additional damage that occurs in, some of the houses and putting out the fire. Putting out fires, do you all have any specific training that you all provide to the firefighters in regards to kind of minimizing any of the internal damage in any of the homes?
So the majority of that is an education piece for the people, the homeowners or whoever's the property it is, on the concepts of fire mitigation and firefighting. People always ask, why are you chopping a hole in my roof? Well, that's considered a ventilation, which enables, it's basically another chimney that allows all the smoke and toxic gases, et cetera, heat to exit out of the house so that you can make your way through the house to get to the fire to be able to see and or extinguish the fire. We also are required to check for extension, because if you aren't sure that you put out everything, fire will get up through heat radiation or just through spread up inside the walls, behind drywall, behind the lap and board siding on the, on the house. So we have thermal imaging cameras, which will look and say, oh, we've got hot spots in here. So we have to open up basically what we call open up the walls or ceiling to make sure that everything is clear. Generally, a lot of these times, these fires might smolder in rafters or on the ceiling joists and et cetera like that. So we have to pull off and get to the bare wood where it's not just sitting there smoldering. Otherwise, it will come back.
Okay, so just because I know we're over time. So
Sorry.
in essence, what I thought I heard you say was really that that there's no belief that there is an issue with providing or expending, additional damage, that the damage or the work that is done is necessary but to put out the fire.
Correct.
And so in essence, what I think I heard you say was that then you educate the homeowners about the work that you're doing.
Correct.
But so there is no training or any work that's being done with the firefighters in terms of how they can minimize any additional damage.
I mean,
So the
that's
answer was
what
no.
we that is part of the training. It's what we call overhaul. And basically that
Okay.
is making sure that you get the fire extinguished, but you're not doing extra damage that you don't need to do. So that is part of the basic firefighter training, is you want to make sure you're established a job, but you're not creating extra damage. And that's just part of basic training that you learn all the way through your job.
Okay, thank you. Thank you.
If there are no other questions, thank you very much.
Thank you.
Thank you all.
All right, next up we have the Aviation Department.
Director Cooper, before you get started, I just want you to know that fire said on at least 2 occasions that they were unhappy that they are now second in citizen satisfaction to the new airport. So they are coming after you for the #1 position again. So
Okay, that's a
just
good
thought you
fight to
should
be in.
warned.
I like it. We'll get loaded up and.
You should just be able to.
Yeah, that's what I was saying.
Perfect. Good morning, Melissa Cooper, Director of Aviation for the Kansas City International Airport and the Charles B. Wheeler, actually now it's Kansas City Downtown Airport, Wheeler Field.
And I am Fred O'Neill, Deputy Director, Aviation, Finance, and Accounting.
Go for it.
Multitasking here. Good morning. Thank you for having us. This is the FY26 budget for the Aviation Department. It reflects the third year of operating in the new terminal and also the third year of operating under our new use and lease agreement with the airlines. Overall, there's very few changes in this year's budget from our last year's budget, so we feel like we are actually starting to kind of settle into things. The new environment that we're operating in has been a challenge the last 2 years, financially and operationally. But we do feel like we're now finally starting to get a grip on things.
Yeah, I say we have tomorrow, actually last night, or 2 years ago tonight, is when we were changing from the old terminals to the new terminal. So tomorrow is our 2-year anniversary, and I, as a mom of a 17-year-old, I feel like I'm raising an infant again. So we have struggled to walk and talk, and now we're in those toddler years, and we really feel like we have kind of figured out a lot of things, and budget being one of those things that we've finally, after 2 years, know what we're doing in that process and what to expect.
Yeah, so we have a submitted revenue budget of $282.4 million and a submitted expense budget of $278 million.
Powerful.
Great, thanks, I
All right.
appreciate it. This is our organizational chart. This is our functions and duties. The Aviation Department we're basically divided into our administration and operations. The administration program provides leadership and management oversight to the Aviation Department so that the delivery of safe, outstanding airport services to citizens, travelers, airlines, and customers can be achieved through innovation, teamwork, and continuous improvement. Our operations side provides the safe and efficient operation of the airfield in compliance with Federal Aviation Regulations Part 139, and acts as liaison to all the KCI airport tenants so that the overall operation for all airport functions is efficiently provided to all airport users. Next, these are some of our key performance indicators. We do track quite a few numbers, but I'll focus on some of the more ones that we feel are more relevant. The first one there is cost per employment. And just a refresher course, we probably have said this 100 times, but this is a metric we use by taking all the airline revenue that's paid to us and dividing it by the number of passengers, or rather the number of enplanements, those taking off. It allows us to be able to compare our airport to other airports, and we use that information when discussing new routes and things with the airlines, just to show how competitive we are priced with other airports that we consider our competitors. This number here, that we're in the $14 to $16 range, puts us just above kind of the middle of the pack for airports that are our size. So we feel like after coming out of the construction phase of the new terminal and all the new debt service, the fact that we didn't jump to the top of the list or the bottom of the list, depending on how you want to put it, is quite an achievement.
Yeah, I think that's very important. We're probably about the 60 percentile ranking, and anybody that has a new terminal is at the 100% ranking. And so the fact that we're still in the middle of the pack is something we're really proud of.
The other big number on here that we like to track is the non-airline revenue. That's very, very important to us, given that our new arrangement with the airlines is that the more non-airline revenue we can collect, the less we have to pass on to them in the form of rates and charges. So every dollar we can increase parking, concessions, property rentals, things like that, is a dollar less that we have to charge to them, which again keeps us competitive. Passengers served per aviation full-time employment, 26,000. Number of passengers, this has been currently a record year. We probably overshot this number a little bit in our estimates last year. We should come in at just over 12 million passengers, and we're continuing to see growth, although it will not be as fast as it was this year. We are continuing to see growth and should come in at roughly 12,169,000.
It'll be pretty flat. As you guys saw, we had our record-breaking year in the 53 years of history at Kansas City International Airport, 12.1 million passengers, and we'll see a little bit of reduction in 25 with an increase again in 26 with World Cup.
Percent of time meeting TSA security alarms, 100%. Charles B. Wheeler Aircraft Operations, 106,000. And aircraft based at Charles B. Wheeler Airport, 220. Again, our total revenue budget submitted is $282.4 million. That's going to be a 6% increase in revenue over our adopted 25 budget. In the graphic below, you can see that most of that is in what we call our KCI Airport Fund. It's sort of our general fund. It's used to cover most of our operating expenses, payroll, contractual expenses. We use it to fund most of our capital improvement plan and major maintenance. The smaller funds there on the right are our restricted funds. They're usually non-operating funds. They're dedicated towards, they have more restrictions on what we could use them for. Here is the total revenue broken out into categories, so you can kind of see where the money comes from. No longer is parking our largest revenue stream. Now that comes from aeronautical revenues. Parking comes in second, and property rental third at 18.8 million. That's one that we're really working hard to try to increase and try to develop the airport property and build it out. Here you can see, this is a little bit more detail where you can compare actual 24, current budget 25, and submitted 26. You'll see in the bottom right-hand corner, we do see a 6.8% increase in total revenue. That's focused really on three line items. We are going to see increased rates to the airlines as our operating expenses continue to go up. We are forecasting more earnings on investments as interest rates rise. Our 25 number is probably a little bit low. That's going to probably come in somewhere between the submitted 25 number and the 26 number. And then also passenger facility charges should be up as air traffic continues to grow. Some of that. On to expenses. We have a submitted expense budget of $278 million. Overall, across all funds, that's a 2.1% decrease. Similar to the revenue, most of the activity in our expenses occurs in the aviation fund. You see our restricted funds over there on the right for their special purposes. The single largest operating expense, or single largest expense we have, rather, is debt service at $96.6 million. Followed closely by contractual services, which combined to be $88.9 million, and A-money at $50.1 million. A breakdown and comparison by category and by year shows that while you do see a 2.1% decrease overall, operating expenses, the top three lines, do continue to grow. The total net decrease is mostly due to decreased capital purchases in the form of equipment, slightly, just down $1 million, and a reduction in our overall capital improvement program, primarily in our passenger facility charge fund. Full disclosure, we had about $10 million in this year's budget that we're not going to wind up spending, so we're going to roll that. So that'll probably end up getting spent next year, so the numbers sometimes can be a little misleading. The biggest increase that we're seeing overall in the form of a dollar amount is in contractual services and utilities has been a number that we're still trying to get a hold of. The new terminal is more expensive to operate from a utility perspective. We did switch over from gas and electricity to all electricity. So we added $4 million in the budget for 26 to help close that gap. And then we're also increasing employee screening with a city contract for $2 million. So operationally, those are really the only two big changes that we're seeing in our operating expenses. I provided a list of vehicles and equipment that we have planned for the 26 budget. As you can see, the most expensive items on there are the buses and fire trucks. We have actually planned two refurbishments for next year. This year, we did put an order in for 3 new fire trucks, but those take about two and a half years to get. So we'll see them probably in 27. On a positive note, we did get a delivery this week for a new M truck. So that was a new addition to the fleet that I know a lot of people were interested in seeing. Here is a list of capital improvement major maintenance. Most of the projects that have dollar signs next to them, you see, are kind of on our land side. These are things that we do to keep the airport looking nice. The ones that you see that have grant and PFCs, those are primarily airfield projects. We rely heavily on the FAA for their AIP grants and our passenger facility charge program. Per city's budget policy, we add those to the budget as the grants become available and appropriate those funds. on a case-by-case basis. Here we have a little bit of history, current and projected fund balance for the airport fund. Coming out of the opening of the new terminal, we did have quite a backlog of major maintenance projects on the land side that we had to dip into reserves to get going. We do project that to level off, and as we move into the next 2 years, we should see a stabilization of our fund balance. Kansas City International is on target for 12 million passengers in fiscal '25 and set records in May, June, July, and September for most passengers ever in those same months. We also saw new service to Hollywood Burbank and Columbus by Southwest, new service to Fort Lauderdale by Spirit, and new service to Cancun and Puerto Vallarta by Alaska. KCI completed several construction projects during the year, including the demolition of the old terminals B and C, and completed construction of new high-speed taxiway connectors on the west runway for increased aircraft safety and efficiency. Completion of the downtown airport master plan supports modernization, expansion, and KCAD's development strategy. The project updated the airport layout plan and completed economic impact study. Downtown airport significantly boosts the metropolitan economy, supporting 2,800 jobs, $250 million in payroll, and over $625 million in total impact. KCI has earned over 37 awards and recognitions for the new terminal's architecture, construction, concession program, art program, and environmental achievements associated with the new terminal program, including achieving number 3 in the J.D. Power Annual Customer Satisfaction Survey for large airports. And I do have a link if you want to see the complete list. And here's a screenshot so you'll know if you hit the right spot. Connection to the citywide business plan. The airport is part of the infrastructure and accessibility. Adoption of this budget will ensure adequate resources are provided for continued maintenance of existing infrastructure, provide funding to support maintenance of assets at good or better condition, develop and maintain condition asset rating plans for all infrastructure and public buildings, and adopt a 5-year plan that funds highest priority needs.
That's our presentation, and we're ready for your questions.
All right, are there any questions?
Just a few. Thank you. It's always good to be with you all, and I think you do some outstanding work. The first question actually relates to the public safety arena. We have seen a number of incidents at American airports lately. Actually, no official reasons have been given yet, but that doesn't mean we don't have reason for concern, either for making sure that we're properly staffed, we have all equipment necessary to detect traffic, conflicts, and beyond. Can you just give us some confidence that KCI Airport is prepared, you have adequate equipment, any other items that you need, and staffing fundamentally to address all those safety concerns?
I'd like to say our number one mission has been and always will be safety and security. That is our basic thing that we do. We do a lot of other cool things, and we have a beautiful facility, and we have a lot of things, but our priority is hiring experts in aviation to do the thing, and that is to keep our airport safe. We don't have the responsibility of anything above the grass, so that is the FAA's responsibility for infrastructure that's related to air traffic control, any of those guidance systems. The airport is responsible for what happens on the ground, and so we work with the FAA Airports Division to make sure we're in compliance with all the design requirements for safety. We work with the Runway Safety Office. Annually, we do our tabletop exercises for both security side as well as the airfield safety side to ensure we're ready for an aircraft accident. If it was to occur every 3 years, we do the required triennial live exercise in partnership with our stakeholders. That was last spring, so that was a year ago. We're consistently looking at how we can be better with our operation. So as we have a snow event, we do an after-action report and look at ways to continue to invest in policies, procedures, equipment, whatever it needs to be better. So that is an ongoing commitment that we have. We try to hire the best, we try to retain the best, and it really is our number one focus. From the airfield safety standpoint with the tower, we're in communications with air traffic control, we're in communications with the FAA. We actually went above and beyond on ramp safety with the new terminal, with the state-of-the-art virtual ramp control. So we, as part of our operational budget, have controllers essentially who are monitoring the aircraft and the vehicles that are operated on the ramp, and until they get handed off into the tower to the FAA, our contracted staff is doing that function as well. So they have the radar and the equipment and the cameras, and they're making those communications and controlling ground traffic that way as well.
Thank you, thank you.
Welcome.
Mayor Pro Tem?
I was actually trying to find it in here, and you probably said it, I probably just missed it. I want to understand more about the revenue, the parking revenues.
Sure.
And, you know, every time I'm at the airport, I know that that wonderful parking garage is full. It's frequently difficult to find a parking space. Are you seeing overall in parking, are you seeing just, you know, a total increase in parking at the airport? And so are you also seeing increases in the economy lots as well? Or have those individuals just mainly transitioned over into that, you know, the parking garage?
That's a great question with lots of layers. So I'm going to try to do that question justice. Generally speaking, we have seen a significant increase in revenue for parking, and parking, that is great for everybody. As Fred indicated, every dollar that we spend or that we collect for non-aeronautical revenue helps defer that cost directly to the airline. So that is a great thing. We have seen a change. So we had an increase in parking last year. I think it went up $2 or $3. So that we thought that might help reduce some of the demand on the parking garage. You see on Tuesdays and Wednesdays, really from about 8 to 2 p.m., a real challenge in our parking garage. A lot of times it's full during that time. That had zero impact. And we found that's for a couple reasons. After COVID, which is hard to believe 5 years ago is when we were facing that challenge, the travelers' habits have changed. They found that the convenience of being able to park in a covered parking and walking across to the terminal is worth that extra investment. And so we've seen an increase in people utilizing the parking garage over spring break and over the summers, where traditionally that would have been an economy lot type operation. But so we have seen an increase in that. We have seen a little bit of decrease in the economy lot, but we feel like that is something that we're going to address. We have a new marketing contract that the council approved earlier, I think late fall, early winter, that we're going to be focusing on advertising and really reminding people of that service. And we're really worked at electrifying our bus system, providing quality service. We've found it's actually a lot easier to operate our parking operation at the economy lot in the new terminal because it's a single stop, where the old terminals, you had 2 or 3 terminals and then 12 stops at each location. It's become a much more efficient operation, therefore being a much better service to our passengers. So we really are going to be focused on that operation at economy lot as well as Park Air Express, and really spend some marketing money trying to regain that ground. For our outside parking contractors, if you think of Parking Spot or their competitors, we do have contracts with them. We get 10% of their revenue as a cost to do business on the airport. So parking in general has continued to increase, and I think the numbers were, I think it was about from 55 to 75 million is what we're anticipating for revenue next year.
Okay.
Did that answer all of it?
Yes, very comprehensive answer. Thank you for that, for all of that detail. The other question, I don't actually quite know how to ask it, but we've talked about it offline, so you'll know what I'm talking about. The concern with the A wing and, you know, the lack of I'm trying to choose my words politically correct here, but just the
Activity.
concern about not having as many flights coming out of that terminal.
Yeah, so I think you're talking about A South.
Yeah.
So A South was constructed for two purposes. The primary purpose for design and construction was for our international gates, and there are common use gates. So we have 5 gates there that if you go on a Saturday and you want to go to Cancun, you're there with all your favorite people because that's when our international departures leave really and arrive in that area. Unfortunately, our signatory carriers, so those are going to be Delta, American, Alaska, Spirit, Southwest, and United, they were a part of the design process and they picked their spaces. And so they're in areas that aren't connected with that international operation. And so we have less operations in A South. So there is a demand issue currently that makes struggles with our concessionaires in that location. And so that is something that we've been working with our concessionaire master developer on solutions. We may end up having actually to come back to council to maybe request some modifications in how we charge rates in that specific location. Those are things that are all kind of on the table for us to consider and to bring back to you for your consideration. The good news about A South is that's where our future is. We have designability in our current terminal facility to have 10 extra gates. And those 10 extra gates are on A South. So any growth into the future is going to be in that area. So that area has future, and we just struggle right now with the current operation.
So thank you for that. What is the timeline on when council may expect to see something come from you all regarding A South?
I don't have an exact timeline, but I was told that I should expect some meetings to be on my schedule here in the next several months. So I would say summertime if I was to have to guess.
Okay. So one other question just in regards to I forgot what it's called, the special mock plane that was established. Are you getting much, because that's still under reservation only. Are we seeing any use of that area? Can you talk about
So what you're talking about is the Kansas City Aviation Department and really the city of Kansas City, our vision to be the most exclusive airport in the world actually came from a resolution from City Council. One of those projects was the Kansas City Travel Experience. And this is an aircraft that was purchased. The capital's already been outlaid, the facility's there, and it is a partial aircraft that families who have any concern with traveling, whether that's small children on how they're going to behave, if there's a person on the spectrum, maybe somebody with a visual impairment, that they can actually come to the airport on a reservation. They're at no cost, work with our marketing department and our customer service experience representatives and leadership, and have 30 minutes or an hour or hour and a half or whatever it takes to actually experience what it's like to come through security, show your boarding pass, walk down a mock jetway, cross into the aircraft, sit in the seats, have the lavatory, have the overhead bins, have the seatbelt, and we have a display system that simulates as accurately as we could. You could see the pushback, you see vehicles moving, you see the lights flashing, things that you experience, the sounds, the dings that you experience on an airplane, and that is available and is being used. Justin's behind me, he might be throwing me a look, but I think we're about 550 families and that have used it.
Yeah, in fact, I just texted you. We've managed about 20 families per week for the last few weeks.
Yes.
And if you could just say that in
Yeah,
the
we have
mic
about
for-
20, average to about 20 families per week who are utilizing that system. So it's something that we are really proud of when any of our peer airports come to visit, or any of our stakeholders or anybody that's wanting to see the airport. We'd like to show that and use that as the standard moving forward. We're really proud of it and what that's done for our community.
Awesome. Thank you very much. That's all my questions.
Madam Chair,
Councilman
I do
Robinson.
want to amplify one thing that Mayor Pro Tem Renee Parkshaw just mentioned, and because, DEI is a part of everything that we do. And when we think about the concessions at the airport, there is an equity piece that needs to be addressed. And it sounds like you guys are on the road to addressing it from a policy decision. But when you don't have as much traffic, right, you shouldn't be required to pay the same rate that other concessionaires are paying because you don't have the demand or what have you. And so I just want to make sure as you're looking at those policy decisions that we're taking it from an equity approach. This was a structural decision by this body, which we didn't know about at the time, like a unintended consequence, that we wanted to be 100% open on day one. And in reality, we should have probably been looking at how do we stage concessions over time for the future. So as those flights come online in Terminal South A, then we ramp up and we build up those concessions versus requiring the concessionaire to be everything open on day one. So we have to come back and right-size this. But I just want you to be aware as you're building that policy decision that we are going to be looking for an equitable-based approach decision.
I appreciate that feedback, and that is what I mentioned earlier, that is what we're going to be looking at is that would require council approval to make those changes to that agreement. I do want to highlight, not this issue, but the required airport concession disadvantaged business enterprise, which is the ACDBE program, which is specifically for airport concessionaires. We crushed our goal this year, and we have continued to crush that. And so that's not that, but I did want to highlight that has continued to be a priority for what we're doing, and the A South disparity is definitely on our radar. We'll be coming to you for assistance on that.
Right, but as elected officials, when we're out in the community, it's, oh, such and such closed, oh, the Black-owned businesses that were there closed. And then we have to go back and explain to them how we position folks based on their investment, right? And people don't get those, oftentimes, the intricacies of the decision. And so that's, again, it wasn't anything that we did intentionally. I think we had really good intentions, but the impact, resulted in some disparate outcomes that we have to go back. But thank you, continue to do a great job with your DBE program.
Thank you.
Great. Are there any other questions in the chambers or online? All right, seeing none. Thank you very much.
Thank you.
Thank you.
All right, we are almost to schedule today. Next up, we have water services. Aviation.
Right here.
Yes. Is it? Good morning.
Good morning.
I'm Ken Morgan, Water Services Director, and with me is Phil Cranamore, our CFO. He's going to present our submitted budget to you at this time.
Morning, everyone. Phil Credible, KCMO Water Services. KC Water has a submitted budget of $573.1 million for fiscal year 2026. This budget covers our three distinct enterprise funds: water, sanitary sewer, and stormwater. This budget covers our operating and maintenance expense, our debt service, and our cash-funded capital improvement program for fiscal year 2026. This is part of the citywide business plan goal of $1.2 billion for infrastructure and accessibility. While we are one city department, we are three distinct enterprise funds that cannot commingle dollars between each of them. The 8010 Water Fund collects fees that support delivery and treatment of water services. The 8110 Sewer Fund collects fees that support the transport and treatment of wastewater services. The 8200 Stormwater Fund collects a tax that supports the maintenance and upkeep of stormwater infrastructure. In addition, we follow industry standards from the American Water Works Association and the Water Environment Federation to perform annual cost of service studies that determine revenue requirements for operation and maintenance, debt service, and cash funded CIP. That allocates costs to each of our customer classes based on their demands on our systems, and we design rate structures that recover those costs. We cover a large territory. Kansas City, Missouri, we cover a large service territory, maintain significant assets, and serve several different customer classes. Kansas City, Missouri covers 320 square miles of geography, and there's over 510,000 residents. We maintain 2,800 miles of water mains, 2,300 miles of sanitary sewer mains, and 600 miles of combined sewer stormwater mains. We also serve both residential and commercial customers, inside city and outside city customers, and large water wholesale and sewer interjurisdictional customers. The water utility service serves just under 177,000 customers. This includes over 158,000 residential customers, over 18,000 commercial customers, and 34 wholesale customers. The sewer utility, serves just over 171,000 customers. This includes over 154,000 residential customers, roughly 17,000 commercial customers, and 27 interjurisdictional customers for whom we treat wastewater. We have one water treatment plant. It has a 240 million gallon a day production capacity, 155 million gallons of treated storage capacity, and produced on average 106 million gallons of clean water per day in fiscal year 2024. We have 6 wastewater treatment plants. Combined, they have a design capacity of just over 155 million gallons per day. In fiscal year 2024, they averaged 78 million gallons per day in treatment. A look at the highlights and major changes to our budget. To cover projected increases in our budget, we are proposing rate adjustments for fiscal year 2026 as follows: a 6% water rate increase, a 6% sewer rate increase. Some of the highlights of our combined budgets, water and sewer, are $167.6 million in cash-funded capital improvement plan for fiscal year 2026. This is a $60 million or 56% increase over the current fiscal year 2025. We will continue to upgrade our treatment facilities. The water treatment plant has been in operation for almost 100 years. The largest of our 6 wastewater treatment plants, Blue River, has been in operation for over 60 years. The water and wastewater industry has also seen significant inflation coming out of COVID, and our rate increases have not kept pace with the industry inflation. A good example of this would be the cost to fix a mile of water main. That cost, mostly materials, has risen from roughly $1 million in 2020 to $2.3 million per mile currently. That's a 130% increase, or annualized 18% per year over 5 years. In addition, the cost of chemicals such as lime and chlorine used in the water treatment process have increased significantly, along with the cost of electricity used to power our 4 major pump stations, 14 repump stations, 15 flood pump stations, and 3 effluent pump stations. Our energy provider most recently passed a 14% increase onto its Western Missouri customers that we are absorbing. We are also getting ready to sell a water bond at the end of March to cover future water capital improvement program projects. That bond will increase our overall debt service in the water utility in fiscal year 2026 and going forward. This slide is a quick overview of our fiscal 2026 budget. We are projecting an overall 14.8% increase that will be funded through our proposed rates and fund balances. Our largest expense is cash-funded capital at $167 million. Another one of our largest expenses is debt service at $105 million, which goes to pay back principal and interest on our outstanding bonds that we have sold. Looking at the budget by program, you can see that our fiscal 2026 submitted total budget of $573 million, which represents all three enterprise funds, water, sewer, and stormwater, is roughly a 74% increase over our adopted 2025 budget. The $74 million increase is mainly driven by a $60 million increase to cash-funded capital and an $8 million increase in debt service. Looking at our average residential bill, the projected average monthly residential bill, assuming the same usage in fiscal 2026 as the current year, is projected to increase from $128 per month to roughly $135 per month. This equates to a 25-cent per day overall increase. This is based on average residential monthly water usage of 3,920 gallons per month and average residential wastewater disposal usage of 3,276 gallons per month. From an affordability standpoint, the projected average bill of $135 is roughly 2.4% of the most recently reported American Community Survey for Kansas City, Missouri, median household income. The Environmental Protection Agency affordability definition for water and sewer is 4.5% of median household income. In accordance with the citywide business plan, these are some of our key performance indicators. Several of these KPIs are water and wastewater utility standard key performance indicators. Our goal for call abandonment rate is to be below 5%. For miles of water main replaced, the goal is to replace 22 miles per year or for next fiscal year in the water system. In terms of sewer main rehab and replacement, the goal is to replace or rehabilitate 25 miles per year in the sewer system. For water main breaks per 100 miles, the goal is to be at or below 35 breaks per 100 miles. And lastly, stormwater basin, catch basins cleaned. Our goal is to clean 15,000 stormwater catch basins per year. Talking about our fund balances, currently the water and sewer utilities have sufficient fund balances. However, within those fund balances, the utilities need to adhere to the fund balance and reserve policies of the city, as well as the bond ordinance requirements as listed in the proprietary fund information in Ordinance 240171. These include having sufficient balances to cover operating reserves, debt service reserves, and renewal and replacement reserves. In addition to these policies, we need to ensure for the ratepayers that we are balancing the use of cash against the use of debt in order to not over-leverage the utilities in the future for the ratepayer base. Given that we have been in an environment of rising interest rates over the last couple of years, having a sufficient cash balance provides management with the flexibility to use cash and lower future borrowing for the capital improvement plans for each utility. Another positive of these fund balances is that the rating agencies, Moody's and Standard & Poor's in our case, look more favorably and generally provide better ratings to utilities in this situation. In turn, this minimizes borrowing costs. As you deplete fund balances, you run the risk of potential rating downgrades, which can lead to higher borrowing costs in the future. Given that we have significant capital improvement program plans in the next 5 years, how we utilize our cash balances, future revenue from ratepayers, and decisions around bond financing amounts is critical to the financial management and strategy of each utility. For fiscal year 2026 through 2030, we are anticipating a water capital improvement program of $1.57 billion. For fiscal year 2026 to fiscal year 2030, we're anticipating a sewer capital improvement program of $2.43 billion. These CIP plans will be funded through a combination of future revenues, bond proceeds, and cash balances. Finally, I'd just like to remind everyone that you can't count on cash balances forever because once they are used, they are gone. And the only way to replenish them is through higher rate increases in the future. Happy to address any questions.
All right, are there any questions? Councilwoman Robinson?
Okay, go back to that last slide. I just happened to be in the finance meeting auditing, and I may have misunderstood it because I'm not on the committee and don't have all the access to all the information, but did you all say that you were going to start including your your capital improvements projects in our in the other CIP program in the finance meeting?
That's, yes, I stated that we'd been in conversations with Tammy and Chris, Director Queen and Budget Officer Morrison about being included in the annual process. Currently, only our PIAC projects are involved in that, and we'd like to have the entire utility programs involved in that so the council's aware and able to weigh in on their priorities within the programs.
Okay, so that's just from an informational standpoint. You're not, this $1.57 billion for water and $2.43 billion for sewer, that's not going to be inserted into our CIP program. It's you just are going to be bringing your CIP program.
Correct. These will remain
Projects.
within the
Okay.
utilities. We just want to make sure that council's informed of these projects.
Okay, and so with this 1.57 billion water and 2.43 billion sewer, can you share how this has changed over, let's just say, the last 5 years? Is this typical, the amounts, these amounts, or are they significantly going up because of these EPA mandates and
Yes,
other?
we've definitely seen some increases. Jeff, Andy, would either or both of you like to address?
Good morning, Jeff Martin, Kansas City Water Services. So there are some significant increases on the horizon due to changes in the regulatory requirements. So lead and copper rules is one that's out there that's going to, I think Phil had that listed up here. We know we got $200 million estimated over the next 5 years with that, and that's a 10-year program.
So sorry, Mr. Martin, I apologize for interrupting you. I just want to make sure, okay, so we have an unfunded federal mandate from the EPA that costs $1 billion over the next 5 years. Is this what this is telling me?
No. What that reflects is a combination of those items along with the things that we have planned. One of the items on that list is an additional water treatment plant and the expenses necessary for that. The other ones are upgrades and upkeeps to our existing infrastructure, the replacement of assets as they age out to replace them. So this is an accumulation of all the expenses associated with specific to water infrastructure and our ability to provide that service to our customers.
And I will add, in the past 5 years, we have seen a significant increase in cost on our construction projects due to inflation following the COVID time. So that was a larger than normal increase for those years.
When you said significant a couple times, when you say significant, do you mean like 5%, 20%? Can you give me some gauge?
So then earlier in the presentation, Mr. Cristobal mentioned, so back in fiscal year 20, we were looking at about $1 million per mile for water main replacement. We're now up to $2.3 million per mile, a large increase in that. So that's more than doubling. Yeah. A large increase from that happened, I believe, in fiscal year 23, if I remember right. We had a significant increase of over 40% in 1 year with that. So.
Right. And this is really important because our viewers and our ratepayers, the people who pay for water, need to know that water is extremely expensive. So is sewage. It's extremely expensive because, we grew up in an era when our water bill was $25 every 2 months. And so now that it's more than electricity, these costs, these billion-dollar costs over 5 years, and it's really good for the public to know the drivers behind that. Thank you.
All right.
Yes, I have several questions. Thank you, Madam Chair. I would like to clarify one of your, on page 10, your KPI on reducing the annual, the number of annual main breaks. What did you say your actuals are now? Did you say 35 miles per?
It's main breaks per 100 miles
per
of
100
pipe.
miles, yeah.
And quite honestly, we are way, way away from the industry standard. The industry standard is 15 main breaks per 100 miles of pipe. And as a result of the attention to our infrastructure, we're trying to bring that number down from 35 and even lower. And so the water main replacement program is intended to address some of that. So as we repair breaks and as we replace water mains, then that has a direct impact on reducing that number to a more reasonable number. And that's one of the biggest challenges we have now in terms of our water mains. You have aging infrastructure, the pipes are old, some of the fittings associated with those pipes are old. And so what this program does, it's an annual program where we identify the pipes that are in the worst shape, where we had the more main breaks in the more problematic areas, and then this is intended to replace those in a systematic way. The challenge, as was mentioned before, we used to be able to pay a little over $1 million to replace a mile of pipe, and now that's $2.3 million. And so that's some of the complexities of trying to do that. But those programs are vitally important. When we look at where we are now, and when we look at a lot of the activity that's coming to our community, these programs help us to be at a point of readiness. You look particularly at what's coming forward, the World Cup. The last thing I want to do is to have the World Cup here and we got water mains blowing all over the place. We may have some breaks, which is consistent with our system, but we want to be in a position where we can manage that.
And so I wonder, so as, definitely I agree 100% with that. And I know in my area, probably for 2 years, it seemed like every month, our water was out. And so while that main now has since been replaced through the program, I wonder if there is an asset management program similar to like what we're doing with our streets and roads and public works, where we have an OCI score of the roads, and we're able then to get an understanding of how, which water mains are in worse shape. We haven't, so they assess the worst water mains, and so streets, and then we actually were able to establish a plan where we, try to minimize the, because it's more expensive to totally replace it. So I wonder if there's a similar system that we can utilize, an asset management system for water like we do for public works.
There is a system, and we're using it. Jeff can probably speak more to that.
Okay, thank you.
But there is a rating system that we use to categorize the rating of the mains, and we have quite a bit of a number of criteria that goes into the criticality, so we can prioritize them based upon that information that
Well, and I don't know that the council has seen an asset management plan around our water mains like we have for public works. Am I missing that?
Is it, yeah, TINO.
TINO, okay.
Yeah.
Yep.
Okay, go ahead.
So we actually do a risk assessment of our mains every year. So it's a total risk score based on the consequence of failure of each main and the likelihood of failure. So a likelihood of failure looks at information like the number of main breaks on the main, the age of the main, the material type of the main. Consequences of failure, we'll really look at who is served by that main, whether we have a reduction in pressure, whether we have a backfeed looping that can continue to feed that area. If there is a break in there, if it's going to cause disruption to a major roadway or railroad, a waterway, that sort of thing. So there's a risk score assigned, and for likelihood and then consequence, those are then combined to get a total risk. We then go through, map out all those risks, and then identify the highest risk mains to replace each year. So that's how we develop our program.
And is that broken down by district?
Yeah, so we actually we utilize GIS for it, so we can actually provide a breakdown by district for those different risk categories, and the risk scores assigned to them. They're all color coded based on severity.
Okay, I'd like to just request a separate meeting for the 5th district, please, offline.
Yep, we can definitely do that.
For that, maybe Councilman Curls would want to be involved in that too. Okay, thank you for that. The other questions I have are in regards to your current vacancies. What is your current vacancy rate?
Our current rate is 22.5%.
Okay. And how many employees does that represent?
Probably around 230.
Around 230 vacancies?
I believe so.
And what processes have you all worked on with HR or just within your department to work to fill those vacancies?
A few things we're doing is we're coordinated with some of the community agencies to where we can access potential employees. We're also prioritizing the vacancies that we have. Some are more critical. One of the challenge areas that we have is in our field group. A lot of our field personnel, just getting them in and getting them employed and getting them in the process is a challenge. Based upon what the pay is, we're looking at pay equity things with that. Recently, we had a challenge in our customer service area, and they went on a blitz and got a lot of employees hired, trained, and the information you saw recently that identified an increase in our effectiveness in customer service is a direct result of us getting those vacancies filled. And so what we're doing across the department, we're looking at the critical positions, looking at the critical areas, and we're moving toward hiring these people. Another piece of that is vitally important, is we're increasing and enhancing the training that we give our employees. Some of the training that they were subject to was older, and so we're updating a lot of the training material. And that tends to allow you to not only hire people, but to keep them. And so those are some of the areas where we're looking at prioritizing and engaging more community agencies for potential employment activities in terms of access and just reaching out beyond the typical places where we look for employees. We're kind of expanding out to other agencies that can be a resource for potential employees as well.
So you actually transitioned to something else I was going to ask about. But I don't want to leave the hiring just yet. So have you, the annual, the huge hiring fair that we did last year, and I don't know if you were even here at the time, but was that effective for your department? We had the annual hiring fair. How many individuals were you able to hire from that? Was that beneficial for your department?
It was beneficial. I don't have the specifics of that, but I know we talked about that in a couple of our meetings, so much so to the point of considering having more of those. One of the things we talked about, and that we're trying to put some information together, is to have a water services department specific career fair. So that we have all of our divisions identified, representatives from there, and the people can come in and talk to the individuals from the various divisions and talked about what we do and what our expectations are, and so they're able to do that. And so I do know that's one of the things that we are in the process of trying to put that together and to see where we can host that and stage that. So it's directly us, as opposed to other departments, it's going to be specific to the Water Services Department.
Okay, thank you for that. In HR's presentation, they talked about how many people we were able to hire in that hiring fair, and I've suggested that we even do that more than once a year. With 225 vacancies, definitely there's a concern about, services being impacted. And so with that, I do want to ask, do you all have any specific concerns about any service level impacts at all?
I will say what our goal is, and I'll answer your question after I preface this statement. What our goal is to provide a more effective service to the customers that we have now. And based upon us providing or having a desire to provide a more effective service, it lends itself into us closely looking at the service we provide. And so when we identify service levels in terms of our response times, in terms of us giving the customers the service that they need, we want to be able to know and to be able to show that we know the service we're providing to our customers. They're our true measure. And it's going to, what we're requesting is going to allow us to consistently make those responses to customers in a timely manner. You look at some of our KPIs, we're adding more KPIs to where we're able to say, when a customer calls, we're responding within a certain amount of time. We're providing a response, a solution within a certain amount of time. We're moving it from the identification of a main break to the repair of a main break in a timely manner. And so those are things that, from a KPI perspective, that we're moving forward to, and they have a direct connection, if you will, to our service levels. Now, that is directly connected to some of the vacancies that we have. And so as we move towards solving some of those vacancies and get more people in, as we move more toward training our staff that we're bringing in, we do know that's going to have a direct positive impact on the service levels that we provide to our customers. Our goal is not for us to tell you that we're doing a good job. Our goal is for your constituents to tell you so you can tell us. And that's where we want to be in terms of the service that we want to provide.
And I think, and that's great, so thank you for that. I think one other goal that I would like for this department to have is a goal to also decrease the number of EEO complaints and discrimination lawsuits that this city has received. This department has historically received very high numbers of lawsuits, which I know was before your time. And so when I mentioned that, you segued into another area I wanted to talk about, was training. Does that training include training of your supervisors of this? And I know this is mainly is HR's role, but I would like to understand, for this body to understand what has transpired and what is in the works for supervisory training in this department.
You know, that's an exceptional question, and I really thank you and appreciate you for that question. Me personally, I'm going to be directly involved in in providing that training. In other agencies that I work for, I was directly involved in the development of training for supervisors, as well as the implementation of training for supervisors. We've talked to our employee engagement staff and our training units within the department, and I'm going to be directly involved not only in the development of the content, but as well as the presentation of the material. I'm going further from that only to meeting with my supervisors, my managers themselves. In the areas where the concerns have been expressed, those are areas I'm going to be directly involved in addressing those issues so that I can make sure that we reduce the number of EEO complaints and as well address the bad behaviors that may exist in the department. And so you have my commitment that I'm going to be directly involved in addressing those issues and making sure that we can turn the corner with those concerns that have been expressed.
That's excellent. Thank you very much for that. My final line of questioning is around your fleet. Can you tell us what your average age of your fleet is? Are you having to, and you know, what's the life cycle? Are you having to rent any fleet? You know, are you having any challenges with your fleet?
I don't have that information readily in front of me, but I can make sure I get it to you. I do know in the industry that we're in, there are certain pieces of equipment that are extremely high maintenance, and the turnover in terms of getting them to fleet to be consistently maintained has been a little bit of a challenge, but we're working through that with them. I'll give you a good area of concern. We have a number of street sweepers, and because they're high maintenance, when we need a street sweeper to perform a task, like say prior to an event, like would have been the Super Bowl celebration. I'm sorry. So events like that.
Too soon. Too soon.
So we would employ our units to go out and do that. And when we don't have a readily available unit, then we may rent a piece of equipment to do that. Another example is at our, when we do maintenance at our treatment plants, we may lease a crane because that's a piece of equipment that we don't normally use. And the infrequent number of times that we use it is better for us to lease. Our regular rolling stock equipment, we will probably lease on an as needed, but we have programs with fleet to where they are maintained based upon mileage, based upon frequency of maintenance issues with them, and then they are staged out based upon that same criteria as well. And so at the current time, we're coordinating with Fleet to address some of those issues to make sure that we have adequate staff to perform the duties that we need to have done.
So I would just, with World Cup coming up, I want to ensure that you have the equipment that you need, and just actually for, to improve our basic level of service for our residents, want to ensure that your department has the adequate fleet that you need. When you talk about, the street sweepers, definitely we know with World Cup coming up, that is going to be essential. And I don't know what the lead time is for that piece of equipment, but my understanding, like with our some of the fire trucks it takes, and even the solid waste, the trucks that Public Works uses, is, on average 2 years. So we'd just like to ensure that we are proactive and intentional about ensuring that we have the adequate fleet that we need so that you can provide the highest level of service for our residents. So I would like to just request that you send me the information I've requested, or send it to the rest of the council. What is the average age of your fleet? If you are leasing any particular equipment, what's the annual, the annual cost of those additional leases for that, or rentals for that equipment? And then what is the impact, if any, to the level of service, level of basic services based upon any of your fleet challenges? That's all my questions. Thank you, Madam Chair.
Thank you. Duly noted.
Councilman Curls?
Thank you, Madam Chair. I think that I kind of expressed some of my concerns at the budget, at the committee meeting on Tuesday. A couple of questions to follow up with that. We had talked about increase in the water rates and the sewer rates, and on the chart that you guys presented on Tuesday, it looks like there's a 5% increase forever on water and a 6% increase on sewer, I believe. Is that what you are anticipating? And I just want to make sure that I'm clear on those numbers.
I believe our model, this current fiscal year, we had a 5% water increase and a 6% sewer increase. I believe our financial model has 6% on both of those in the future years.
Okay. So the sewer will go up another percentage then?
Correct.
Based on future years. Okay. That still is concerning to me, but we won't get into that today. Back to your other slide in regards to the storm drainage and the sewer drainage, I think that you had up there, storm catch basins cleaned. How are those prioritized, and whereabouts are the 15,000 or the 10,000 that you actually cleaned? Do you know? Because I've received some requests and some concerns about a lot of these that are filled with leaves, been filled with leaves for years. And so I know that the water does not drain properly. And this is in South Kansas City, basically. So I'm just concerned about how you prioritize the cleaning of these and why these have been plugged up or stopped up for so long. And how can we get them cleaned, maybe?
311 service calls are a big driver of a lot of those. So whenever a citizen observes, notices the storm drains clogged, flooding, if they'll put in a 311 ticket, that'll allow us to know that that's actively occurring, and we'll dispatch a team to address it immediately. I don't know.
One of the challenges in terms of the ownership of the catch basins, a number of them, and I'm not saying all, but a number of them are on private property. And so what customers do whenever there's a backup, they just call us. And when we send staff out to evaluate and to assess, then some of the things that we find is that those some of those in questions are on private property. One of the things we are required to do is to maintain ours. Now, I'm not saying we get to all of them, and to your point is well understood, but we have a requirement to categorize, that's to capture, and then to provide an assessment on the front end, and then the needed maintenance on the back end. And that maintenance may lead to a capital project. And so just like our other systems are assessed and prioritized and or set for a capital project or CIP program, we do that in all three lines of service, water, sanitary, and as well as the storm. So we are required to perform those assessments and to perform that maintenance regularly. And we have records that reflect the maintenance where we've been. And we are required as well to keep those records and to provide response. One of the things that I want to do moving forward with a lot of these areas is to provide a report to this council as well as the mayor that accurately reflects in all of the districts the work we've been doing in all of these lines of service. You probably haven't been getting this information, but this is information that I believe will be helpful in us telling our story in terms of the responsibility that we have in maintaining these assets, so you will know. And it's also helpful when you meet with your constituents for you to be able to tell them this is what we've done. And then we can answer any questions related to those areas as well. And so we're prepared. And matter of fact, quite honestly, I'm excited about going into your areas to tell our story about what we are requesting and about what we're actually doing with what we request. I think the customers deserve that, and I want to make sure that we provide that as well.
Well, these particular ones that I'm talking about aren't on private property. These are on
Okay.
street corners.
Can you send me a list of those?
I can give you a whole area.
Okay.
I mean, because it's not just one particular location. I mean, well, we'll talk.
Yeah,
about it.
yeah,
I
you
can-
can,
I
if you
can
would
send
provide
you a
that, I can
list.
make sure we get that covered.
Because the leaves have covered up where you don't even see the sewer anymore.
Okay.
I mean, and so constituents have called me and says, how come the city doesn't clean these up? And this is not private property. This is, when you come to a stop sign and you look over there and there used to be a sewer there, now all you see is leaves. So I know that causes flooding, it causes backups, it's causing a whole lot of other concerns and issues. And it just has not been addressed. So that's that. And I'll give you an area or send you a location.
Yeah, please do.
Certain locations for those. And my last question is, I heard something and some concerns about these data centers that's coming up and the amount of water that it's going to take in regards to these data centers. Are you guys looking at that, or how is that going to affect our water system going forward?
So, yes, the initial answer is yes. And the supporting information for that answer is based upon a couple of things. We have, at our plant, we have the capacity, at our existing capacity, to provide enough water. In our infrastructure, we mostly have the capacity to convey the water. Now, if you think about what we're requesting in terms of an increase to maintain our system and to keep our system upkept, then that is geared directly toward being able to provide the capacity that these agencies are going to need, because we know now they're moving into our community. And so when we are requesting what we're requesting, part of that request is to make sure that we can provide the level of service needed, not only on the incoming side for them from the water side, but also on the other side when they discharge into our system as well. And so those things are all connected, you know, and one of the things we're really excited about is having the infrastructure that not only data centers want to come here, but a number of other businesses want to come here. We saw that the population of the community has been relatively flat over the last several years. Well, when more businesses come, then that creates the opportunity for more homeowners and more residents to come. When more people come, then we got to make sure that we have a system or the various systems in place that we can provide the necessary services that they desire. And so all of those things are connected. And so we have been looking at that. We've run some models to make sure that initially we can provide. Additionally, where they're requesting more than what we supply in terms of the existing size of our system, then a lot of them will participate in increasing the size of those supply lines as well. And so a lot of those things we've taken into consideration, and I think we're ready. And, at least I like to think that we're ready to receive more of them coming into our community.
Okay. And my last question is regarding street sweepers, and I don't know, maybe you addressed it or not, but how many street sweepers do we have, and how are they deployed throughout the city?
I think we got about 11. I could be wrong, but we have a schedule of where they sweep, and then we have a couple that respond to questions and concerns. So they have a program to where they go to general areas. They're assigned on a regular to sweep in those areas, which is typical, their process, just like we do in our other areas. It's a programmatic approach. And then we may get some calls to say, hey, can you have, or like the ones that you're going to give me, we'll be able to respond to those as well. But I think between 11 and 13, I can get a more accurate number for you, but I think that's about how many we have.
Okay. And just to follow up, is there any plans to get any more?
Yes.
Yes, most certainly is.
Okay. Thank you.
All right. Any other questions? All right, thank you very much.
Thank you for your time.
Thank you.
Thank you, Water Services. We have our Health Department next.
Looks like we lost the presentation there, Krista. I don't know.
Good morning.
Closed out, didn't
Let's see if we open PowerPoint.
helpful people. They were done, they were done.
They were done. Out the
They ran
door.
away. Last screen,
Thank you. Good eyes. Apologies for that.
teamwork makes the dream work, right?
Sorry.
No problem, thank you. Hey, good morning, council and other viewers. My name is Marvia Jones. I'm the director of the Kansas City, Missouri Health Department. With me is Will Rand, our financial manager. Also have our deputy directors here. We also have our division manager, Terry, as well, but Nasser Jahari, Jackie Diller are also here. So thank you for your time. All right, so you guys have seen this chart before. I don't want to belabor the point, but I show it again just to depict the wide breadth of expectations for a well-functioning public health service system based on the DeBeaumont Foundation, the CDC, and some other integral public health leaders. We have there is identified a list of services and tasks that should be carried out by any well-functioning health department. I'm proud to say that we are implementing these. To some degree, all of them are in our purview and are currently represented in the budget today. Again, when we're looking at what is public health, you hear a lot about the outbreaks, the tuberculosis that folks have been wondering about, and you hear about the opioid substance use disorder conditions, and you hear about these different things, and we publish the community health assessment that shows what people in our city are dying from at any given time. But kind of upstream from that are these other things that are more so behind the scenes that you don't know that we're working on, or we have to consider in our work. Different conditions do impact different groups differently, and we know that the root causes of some of those sometimes sometimes differ as well. So when you hear us talking about living environment, or we're talking about housing, or we're talking about these other things, those all feed into and correlate with public health outcomes. We have included just a snapshot of some of our major key performance indicators. I'm not going to read all these to you out of the interest of time, but I want you to notice that we have a wide range of indicators that track multiple aspects of our work. So at the top line here is talking about preparedness and the extent to which we are responsible for preparing residents for the next natural disaster or pandemic or what have you. How do we ensure that residents are ready for that? So that's a sort of a neighborhood by neighborhood intervention. Then we're thinking about communicable diseases that are investigated. I've had a few calls about tuberculosis and what's going on and how will we react in Kansas City if we were to find cases. We actually track, the percentage of them that require investigation and the speed with which we can reach people who might have been impacted. We track HIV services as well as folks who are linked to care when they are diagnosed with critical illnesses or critical infections. Some of the other things are around health education and outreach, training leadership. That is important to us to create a culture of learning and a culture of quality, high quality leadership. We continue those efforts and we do track the implementation of those. And then getting towards those last two, even the nuts and bolts of how we do our environmental regulatory work. Food complaints completed and investigated within 48 hours, as well as lead abatement, and the extent to which we follow up and check on the living circumstances of children who've been identified with elevated blood levels. And then, of course, we have some safety net clinic and safety net provider metrics. You'll see later that the safety net is a key part of our work, and we take the job very seriously in terms of how well we're serving Kansas City residents with those funds. So we do track the number of patient visits and patients served, and of course, the number of encounters that are seen in those places. I'll turn it over to Will now.
Thank you. I'm William, Physical Officer for the Health Department. The Health Department is part of the Housing and Health Communities, citywide business plan goal, which includes two budgets.
Can you move your microphone just a little bit closer?
Yeah, this includes two budgets, one being the Health Department budget at $34.5 million for this fiscal year, then Health and Medical, which is also $34.5 million for this fiscal year. This slide depicts our department budget by program. Thank you. I won't go into each of them, but I will touch on some of the larger budgets, starting with behavioral health and injury prevention. You'll see that budget is about $11.5 million for this fiscal year. This includes $6 million from the Violence Prevention Fund. I just want to point out that of that $6 million, about 40% is dedicated towards the REACH program, so it did not get its own budget this year. And it's going into the third year of the 5-year period. The Aim for Peace program is also included in this budget at $1.3 million, and there was an additional $1 million from the marijuana sales tax fund that was added to support Aim for Peace, and as well as opioid funds are also included in this budget that we've been using to fund substantial contracts for treatment and rehabilitation of those suffering from or recovering from substance use disorder. The other budget I'll touch on is the orange budget there, or red, depending on how it looks to you, for our environmental health services. One of our more recognizable programs, which includes our field inspectors who go out and will do inspections on all the active establishments all the way around the city. They also perform inspections on public pools, hotels, to ensure that even our visitors to the city can enjoy a safe and healthy stay, whether they're here for a Chiefs game or the World Cup. They also perform, this budget also supports the air quality program, our childhood lead poisoning prevention program, and our Healthy Homes Rental Inspection program, and our child care facilities also get inspected with this budget. The next budget I'll talk about is the communicable disease budget, our third largest one there at $7.3 million. This is supporting our disease investigation staff who will investigate, monitor, and track any infectious diseases in the city. That's your flu, COVID, tuberculosis, STDs, you name it. Identifying patterns that are seen, and then reporting data both internally and externally so that we can use that to better respond to any potential outbreaks. Overall, the Health Department budget has a growth of a little over 3%, even though you won't really see that reflected here. To me, the biggest thing that stands out to me is a decrease of over $11 million in the total budget, or 25% from last year's budget. The Health Department has been fortunate over the last decade and more to receive several federal and local grants that have allowed us to expand the services that we provide to the community. This year, it was decided by budget to not include those grants in this fiscal year's budget. So
It's not an actual decrease, it's just not represented.
yeah, so there is an increase in the total budget as far as city funds go, but we did not include those grant funds. This next slide is for our health and medical department. The main thing to note here is that there was a 3% increase across the board for all of our safety net providers. So some of the highlights and major changes to the budget. As I mentioned, the Violence Prevention Fund is going into the third year of its 5-year period. There's another $1 million coming from the marijuana sales tax. In this budget, we are also asking for 36 new positions to be created in order to increase our coverage in several of our core areas, including nurse home visiting, STI or STD outreach and investigation, health inspections, pest control, asthma control, child maternal health morbidity, as well as data analytics. Another major change is that, again, like I mentioned, we did not include grants during this, in this budget. And for health and medical, there was as I mentioned, a 3% increase across the board.
You. So now I'm going to just take this opportunity to tie our work back to the citywide business plan. As Will said before, we are in the housing and healthy communities section of the plan. And I chose to just include a subsection of things that we have submitted in our budget request for next fiscal year. And so I wanted to point out how those requests would help us with our strategy. So just looking at investing in harm reduction strategies for the city's vulnerable populations. There are some groups in our city, so everyone is at risk for sexual health infections or sexual infections. There are some groups who have different levels of risk due to just other vulnerability, economic vulnerability, whether are they, what their living circumstances are, all of that. And so the ability to hire an additional 4 folks will help, we hope, take us from the number of investigations within 7 business days going from 29% to 65%. That is a goal of that work. And that is a goal for this fiscal cycle. And then the next one, proactively assess living spaces to ensure residents have environments in which they can thrive. We're looking to increase our inspection staff levels from 8 to 22, which will facilitate proactive versus solely complaint-driven inspections of high-priority rental units. So we don't have enough staff, and I don't think the budget would ever support feasibly or reasonably the number of staff it would take to go proactively look at every rental unit. That wouldn't make a lot of sense. But we could apply the same kind of tier system or tiered approach and prioritization approach that we would to a restaurant. Some restaurants, just based on what they sell, are higher risk than others. In the same way, there are some rental units based on the age of the property and, different things like that. We know those are at higher risk, so we could be more proactive in not waiting for someone to make a complaint. Right now, we're not doing that at all. We're only solely complaint driven. And then for the last one, improve access to necessary basics such as food, transportation, recreation, and health services. Many of you may be familiar with our Nurse Family Partnership Home Visiting Program. We are excited this year because, by cobbling together some different funds from this request we've made, as well as other city dollars, in addition to the state funding, we are going to move away from just having to only work with new mothers, so first-time moms, being able to expand that and serve folks who, this might be baby number 2 or 3, but they still could use that extra support being connected to whether it's substance use programming or getting their economic situation, looking for work or whatever they might need to do, routing them to childcare, all of that. So right now, folks are waiting an average of about 35 days, and we want to move that lower so that, reduce that time frame so that no one's waiting 30 days or more. We know that in the middle of a pregnancy, every month counts, and so we want to provide those services more quickly. And so these are just a subset of the different ways in which our new funding request ties back to the citywide business plan. And then finally, as we hurry to a close, we were asked to kind of talk about how our resident satisfaction survey results influence our work and what kind of things we've taken away from that. We realized humbly, with all humility and, everything, we realized public health is in the background. People really are not thinking about public health, but that's not as discouraging as it would sound, because we know that when we're doing our job and we're doing it very well, you will not hear of us quite a bit. The department was more known during the height of the pandemic because we were more vocal about, where people can go to get testing. There was some regulatory pieces. And now that has moved more into the background, we are not on people's minds as much, so that was a takeaway. But while we're in the background, we realized that we need to just take a more proactive approach to building or creating and continuing a healthy background, making sure that the background environment, even if you don't know about it, and residents aren't saying, oh yes, I'm grateful for the health department for doing this, that we know that we're doing it. So that goes back to those things we've talked about, the healthy homes inspections and being more proactive around that. The food, lodging, childcare, pool inspections, the new funding request would feed into that and allow us to more quickly address complaints when they arise. And then in the off time, when people aren't complaining, we're still ensuring a strong presence so that we maintain that environment. Increasing outreach to mothers. I visited the Memphis Health Department a few months ago, and I was so inspired by what I saw in that they actually call every mom who gives birth in their city. That was amazing to me because that is what is considered a universal approach in public health, and obviously that required a lot more resources, but the benefit of that was that you were able to get people who were at sort of a low level need, but also identify the folks who were like, man, you called on the right day, I'm struggling, I don't know what I'm gonna do, I need help. And so we are not there yet in our city. We don't get the data yet in terms of we don't get birth data like they do in some cities, but we are going to start with the folks who seek out Nurse Family Partnership service, our home visiting program services, as a beginning to that. And then expanding the science, and the importance of that piece is that if you can catch people early on, you can catch them in a level of need early on, you kind of prevent some of those downstream effects. So the earlier we can get to people, the better. Again, trying to create that healthier background while we're there in the background. Expanding the science and surveillance team, we're happy and excited. I know my chief science officer is excited to be able to have more epidemiologists who can help us get ahead of, we can know, okay, tuberculosis is in this region, it's in this area, maybe even before you guys start really hearing about it on the news, we'll be able to have projected more information out about it and let the community know, but that takes capacity. And then expanding the disease investigation team, we've already talked about that and how that will help us get ahead of what is currently an unspoken about in larger circles, but very real syphilis epidemic in Kansas City, as is across the state and in many places nationally. And then promoting chronic disease prevention. The health department in Kansas City has not had a chronic disease program in over a decade, probably closer to 20 years. And so in the past year, we have really been working to start a chronic disease prevention program, and that is timely in that one of the if I can dare say, a silver linings of this new administration is they have been really focusing on chronic disease prevention. Right now in our city, we are not unique in this, but in our city, an average of 4 years across all groups are lost due to heart disease. Another almost 4 years when it comes to cancer. And yet we don't really have much on our parts in terms of health promotion and chronic disease prevention. We're not really doing much. And so one of the parts of the budget request that we submitted is to really help build the groundwork for that so that we can really be a force for chronic or health, I'll say health promotion in Kansas City. All right, that is all I have for now. Looking to your questions.
Thank you very much. Councilwoman Robinson.
Thank you so much. Thank you for your presentation. In the budget book, and I do want to, before I get started, want to level set in our budget book on page 246. I just want my colleagues to really look at our housing and healthy communities is 12% of our budget, and our public safety is 27% of our budget. So when we talk about, funding what we value, we talk about budgets as a moral document, and we talk about us being in a very challenging situation as it relates to crime. We know crime is about behaviors. When you think about people committing crime, no matter what the crime is, it's about their behavior. And we are funding public safety at 27.6, which includes fire and police, and our healthy communities is 12.5, and housing and health. So on page 57 of this document, it says, I just want to make sure this isn't a typo. It says that the health and medical is 34.5. Is it 44 million? Is that just a typo? Health and medical, 44 million?
It is 34.5 million.
And then the health department submitted budget is 34.5, and health and medical is 34.5? Okay.
Two separate, pieces.
Okay, because our health levy is a separate piece, right?
Correct, yeah.
Okay, so altogether, it's how much?
Almost 70 million.
70 million, okay, thank you. In the budget, it talks about the IRIS system and 250 people. Is that is that actually the transportation system? We helped 250 people through IRIS in your budget?
Councilwoman, and I don't have a print version. I'm looking on the online version. Which program page are you looking at for health? So I can help here.
Oh, I was looking at,
Because I would not expect IRIS to be part of the health department budget. So if there is some statement in there, I think we have something to correct. So I want to understand.
it says that it is, 34.5. I thought I saw something that said 44, but no worries. But there was something on the program accomplishments that talked about the IRIS system, 250 people being supported by IRIS. And so I just wondered if that was, here it is, it's on page 257. Connected 250 resources through the IRIS system. I didn't know if that was our connection with our transportation system or not. Developing a case management database.
Oh, no, that is, so two different names, I'm sorry about the confusion. IRIS is another case management system, so that would have been through
Okay.
is it health workers? Huh? Community health workers team.
Oh, okay,
So
because
not
I was
IRIS,
thinking maybe IRIS was helping people get to their medical appointments or something. That would have been awesome. Okay, so two different systems.
But I can talk to that. So I am excited about it. Something we have been talking about. We've been working with Director Shaw and KCATA to begin helping recently deliver moms or even prenatal visits, be able to have some free transportation for prenatal and postnatal visits using IRIS KC, the one you're thinking about. So that is also something we're working on.
Okay, yeah, if you could give me that information, that would be great, because one of the major complaints that we have from people that are expecting is the wait time. So they're depending upon the state-run system. They only have one contractor, and the type of services that they're receiving is extremely undignified. It requires you to take off from work the whole day. It's extremely challenging for mothers, and so if you could keep me up to date on how that's working, that would be great.
We will certainly do that right now. So we've had multiple meetings, and right now it's in the hands, I think University Health is trying to figure out how to set up in their system so that their staff know how to order, but we've already gotten a go-ahead, budget's good, all of that. So we'll give you more updates on that.
Wonderful, thank you so much. Is the citywide doula program, is this in the budget this year?
Yes.
The citywide doula program was one of the, it was funded through ARPA funds, so it is not included in this particular budget.
It's not in the budget?
Funded this year.
Okay, that's a problem. So the Nurse Family Partnership Program, how many nurses of color do you have?
I don't have that information right now.
Is there a disparity in the number of black nurses that you have on the Nurse Partnership Program?
I would say that at this time, we are not, I don't believe we have any black nurses right now. We have others of color, but we don't have black nurses right now.
Okay, so do you support the data related to doulas in terms of their effectiveness?
We're talking about doulas?
I'm talking about doulas. Do you support, as our health director, the efficacy of data? Okay, so you support the doula program. You're expanding the Nurse Family Partnership Program that has no black nurses, but you've cut the citywide doula program from the budget?
Yeah, I think that was a misspoke. We have not cut the doula program. We actually have an active contract right now that is slated to go in for another 2 years. And that we have changed the doula program to where it's not the same vendor, it's a new vendor. And we expect, so it's got an economic aspect to it, and it has a actual doula service piece. So it hasn't been cut. I think what Will is trying to say is that it's not reflected here because that was part of a grant fund. So remember, we couldn't include the grant in this, but it is covered.
Okay, so can you send me something in writing to say that that program is included?
Sure.
Thank you so much. And then can you go back to the slide where it talks about the behavioral health? I think it was 11. Okay, yes, this is it. Thank you. Okay, you said that, is it this mostly funded by the $6 million? The $6 million of the 11 million is coming from the fund that Mayor Pro Tem set up?
Yes.
Okay. What are we gonna do when those funds run out? Because when do they expire?
This is the third year of a 5-year period, so there's 2 more additional years after this fiscal year. I'll have to refer to probably
Okay, so we have 2 more years. Well, I'm concerned, given the structural imbalance that we've been hearing from a larger perspective, if we believe that behavior is at the root of crime, we've already, public safety is, twice your budget. And we're getting ready to slash this budget because the funds are gonna run out. And it'll be at a time where we're more pressed for resources, according to the economic outlook for the city. So what are gonna be our strategies? And this may not be, if you haven't thought about it, I understand that. But we do need to have a strategy in which this isn't negatively impacted. And maybe we've been thinking about it from a policy perspective. But when you said that, 6 million of the 11 million is coming from an expiring fund, it kind of gave me a red flag, so. Okay. All right, those are all my questions. Thank you.
Yes, thank you. Thank you for the presentation. I'll just take a second to just back Councilwoman Robinson's comments and lean into those. Definitely concerned about the behavioral health fund and the violence prevention fund and the impact there. So definitely from a policy perspective, I think it will be beneficial for this council, this body to look deeper and have an understanding about the outcomes of those dollars that since we're 2 years in, now, and so I'll just take a second to publicly say I'm going to request a business session so that we can receive an update about that, and then we can look at potential policy discussions in terms of looking at maybe extending that into additional years. I also want to just clarify, you mentioned in your budget, and I've seen it in the other budgets, the marijuana tax shows $1 million, but in our discussion the other day, I believe the director said it was actually $2 million for marijuana tax, so I just want clarification.
Sure. So I think what's happening is the marijuana tax in the current budget was $3 million. In the submitted budget, we're bumping those estimates up to $6 million, so it's doubling. So when departments are talking through major changes, they're bumping up from $1 million in funding to $2 million in funding in the area of health or in the area of trash. So I think that is where the distinction of the increase of $1 million from the current budget, which is $1 million.
Okay, so ultimate, but I don't think their slide said that, unless I'm mistaken. I don't remember what page it was on. But so you have an increase now, so a total of $2 million from included in the violence prevention fund for from the marijuana sales tax, but it's an additional, it's $2 million, an additional one. So
Yeah, where it would usually be 1 million, it is now 2 million.
so in essence, this year for in this upcoming year for violence prevention funds, we have $8 million available.
That is,
Go ahead.
yeah, so there's $6 million appropriated in the Violence Prevention Fund. That's our annual appropriation. We've also dedicated $2 million, that's a third of the marijuana sales tax fund, for a
Right.
total of $8 million.
Well, I wasn't going to make us do this, but I think, can you go to the page where it says it in there? If you go to that slide that shows the marijuana sales, or the funds. Yeah, see, year 3 is funding the amount of $6 million and $1 million from marijuana sales tax. It really needs to say $2 million, so a total of $8 million. Okay, so in your plan, do you have $8 million, an allocation or appropriation of $8 million for violence prevention efforts in this next year, in this budget?
Yeah, so I will start with that. I don't believe we had a breakdown for that full $8 million. We have not, because this part had not gone through yet, we have not planned on additional funds in that regard for the next fiscal cycle. We would, incorporate that afterwards. I would say of the $6 million original, some of that is for REACH. And so that is already kind of removed from that. Also included in this marijuana and this other stuff is like Aim for Peace and the violence prevention projects that are going on around the city. And so there are quite a bit of this. I don't want to give a specific number. We can get that in a follow-up. But quite a bit of this is already sort of planned. I don't want to use the word appropriated. I don't know that's I can use that for this. Right. The plan, yes, it is. There is a plan that we can send to you that outlines all of that. We haven't made plans on $8 million, though, I would say.
So I would just request that, as I stated, I'm going to talk to the mayor and the other council colleagues about having a business session in the future.
Yes.
To really dig into the details of this violence prevention fund, and would just like to have that clarification at that time. And in this next budget year, what initiatives, what plans do you have underway that we can expect forthcoming? All right, the other question I want to clarify, if you will go to page 59. All right, there it shows in red, or I'm sorry, actually it's a little sliver, $154,000 for Swope Geriatric. Can you explain what that is? Can someone explain what that is? Is
Sure.
that some kind of debt or something?
Yeah, that is the final, that's the debt payment on that facility.
But if we have an agreement, I thought we closed that out. We sold that property in the partnership with Swope Health in the Swope Health Village. So shouldn't that be removed? Because that.
And I see, yeah, Timmy, I'm pulling up the debt schedule
I think that
too.
I think that is handled by a contribution from the purchaser to make this payment, because we can't not make the payment. We still have the debt. And so it exists out there, so we have to make that payment. We will use the source from the buyer to actually make that payment, if I'm remembering it right.
Well, yeah, but we finalized the agreement with them, right, to purchase the land. Yeah, I guess we can talk more offline, but I'd like to see what that looks like. I know that there's really a partnership type of an agreement, but just, you know, so if this $154,000 is accurate, then how many additional years will we see this on the budget? If not, you know, I just would like to understand specifically what's happening there, because my understanding was all of that was finalized with the sale of the property.
It was. This should be the last year that you see it, but we'll confirm that. And what is likely true is that there is a revenue source on the revenue side to cover that $154,000 debt payment. But I'll get that information to you.
Thank you very much. All right, the other question I have is your comments. I believe you said that there was a 3% increase for all of the safety net providers across the board.
Yes.
Did I understand that correct? Okay, I just wanted to confirm that I heard you correctly. And then finally.
Well, can I?
Oh, sure.
There's one. I don't know if it was through an amendment process or something else, but I saw that Northland Healthcare Access sent in a different request through a different technique, and that would probably put it at a different level. I don't know what that percentage is, but it will be different. But it's not finalized, but this is the amount we've proposed, but I think it came in another way.
So meaning that there's a potential amendment in this?
Yes.
Okay. Okay, would like more clarification about what that looks like.
I can assist with that as a follow-up. It was an increase, you'll see an increase to Northland Care Access at a rate different than what the Health Department talked about, the across-the-board increases. And that was, came through the city manager's budget. And we'll get with the city manager's office to get more information to you on that.
Thank you. Okay. And then definitely want to uplift my support for chronic disease prevention program, as I actually used to run and oversee Kansas City's chronic disease prevention program when I worked for the State Department of Health. And I didn't realize it had been that long since the city had a program. So definitely want to pledge my support for any assistance that's needed in developing that program, and would like more detail, more information about some of the data and information that has transpired since then. Are there any grant opportunities or anything from the state level? Because that's what I oversaw at the time that I worked for the state, that we were receiving, Kansas City was receiving funds from the state for chronic disease management program. Any opportunities there?
So right now, our chronic disease program is being funded partially from our core public health services grant. We've been able to utilize, from the state, we've been able to utilize some of those funds for chronic disease prevention purposes.
Okay.
Yeah, so it's kind of packaged in there. So in there is like some inspection work, some, disease investigation work, some vital records, like and you can use a little sliver of it. So I would say a year ago, we were still looking for federal funding and support. That well seems a little dry right now, but maybe within another year or so, but we are trying to get things started with the resources that we have.
Okay, thank you. And I just have to uplift your department and even our former First District Councilwoman Hall. Prior to several years ago, you all really weren't in the space of mental health at all. And our partnership in the legislation to have the health department start working in the area of mental health, from the concerns and issues with the pandemic that came out of the pandemic and other areas that Councilwoman Robinson has already mentioned today. Really would just like to commend you and your team for really jumping in and being a leader in Kansas City around this area. I know violence prevention, with the blueprint for violence prevention that you helped to author many years ago, 6 or so years ago now, I know was the start of the violence prevention work. But I just really want to take a moment to commend you all, because not only have you taken that on, you've taken on many other areas that this body has tasked you with, and I think you all have done an excellent job. So thank you for that. Thank you. That's into my comments. Thank you.
Madam Chair, I just had one thing I wanted to share that I shared with the fire department that I think would be helpful to share with you all as well. And that is our goal for hands-only CPR training before the World Cup. If you could start to maybe think about ways that the health department can lean into. You have an amazing health ambassadors program, but we need to get 100,000 residents trained in hands-only CPR to help us with the management of keeping people alive when we have millions of additional visitors. So our EMS will be very taxed during that time, and so it is critically important that as many people as possible be ready. So if you guys can think about that and how you can lean in. I know we've asked the health department to do the same. I mean, the fire department to do the same.
No, I appreciate that challenge, and I'm happy that we have Taylor here, one of our community wellness ambassadors, and they did all get trained. And so the next step is figuring out how to fan out and train others. So yes, that is definitely a goal of ours. So thank you.
Thank you.
All right, Councilman Duncan has his hand raised, so he has a question.
Very briefly, apologies, Madam Chair. Yes, so I know we've talked about this before. I just want to flag for my colleagues that Dr. Jones, if at any time federal grant funding becomes at risk because of our DEI programs, that I would like us strategically and give us, you're the canary in the coal mine. So let us know what's going on so that we can respond effectively, so that we can ensure that we're keeping the dollars while still maintaining our goals.
Yes, I appreciate that. Yeah, that's something that we are definitely monitoring and concerned about and trying to do some planning around, as are all health departments right now. Just left DC with the 35 directors from some of the larger and medium-sized cities, and all of us are running the same calculations now. We do know that in Kansas City, about 95% of our grants are federal. Our grant dollars are federal, and so we are, moving into a mode of, okay, if this, then what? What types of core services will we have to maintain? I know that in the past, the health department, we always return money back to the unappropriated fund balance or the reserves for the health levy, but it has been something on our minds that if worse comes to worse and there is, of course, something like HIV services or the services to folks who are living with HIV and need to have a certain level of care so that they remain a low threat for transmission, we would need to be able to go back into that reserve if needed, because that funding is primarily federal. And so there are some critical things we're watching, and so we do appreciate that support.
Councilman Rea.
Thank you, Madam Chair. Dr. Jones, I appreciate the presentation. Couple questions. The City Council recently passed a resolution in regards to our health department providing certain information that, was either not available on the CDC's website or was taken down temporarily. And I think it started off a conversation about what else from a public health perspective we might need to do or space we might need to fill. I know that the CDC has made a commitment to end certain public health information campaigns around vaccinations and some of those things. And I know that you all understand the importance of making sure that information is out there. Maybe we already do some of that, but I continue to wonder the extent to which, as the CDC or our federal institutions become less reliable over the next couple of years, how we step into that space. Is any of that reflected in your budget, and what are your general thoughts on it?
Yeah, for sure. That is a big question that we have now. A lot of my counterparts in other cities and I are talking about what do we do as the information coming out of those agencies becomes a little bit less reliable. And yes, so part of our budget request, I think two or three positions that we have here are to build out our own local data office. Really proud of the work that Dr. Francisco and his team have been doing to build out our community health assessment, to ensure that we know exactly what's going on locally in terms of our residents' health. We have two surveys. I hope you all, if you get the one for chronic disease, that should be in your mailboxes sometime soon. We have data coming from many different sources that we hope to be able to sort of buttress our existing data, so that if we can't look on a website and see what data for Kansas City looks like, we still have that. Those positions requested will also be responsible for going out and going straight to the source. So the federal partners like the CDC generally review all of the science that is being put out by researchers, right? And they basically translate it and put it on their website for people to go pick out. We have invested in our own department, direct access to the research. We've built that out. That's a couple weeks. It was an investment, but a necessary one, especially in these times, because we are going to have to do our own going out, searching for the information, translating it for local providers, local programs, and our own work. So yes, we definitely realize that we're just gonna have to step up a little bit in terms of our own information locally.
Yeah, I appreciate that, and I imagine it'll continue to be a moving target. Seems folks can be very creative in the ways that they choose to be destructive, and maybe some ways that are maybe unforeseen as of today. And then one last question, and this is not in relation directly to a budget item, but you mentioned it and made me interested. You said we don't receive information from hospitals around when new Kansas City residents are born. You said other cities have that information. How do other cities obtain that information, and what would it take for us to make that information available to you?
Yeah, so other cities have the benefit of being on shared data platforms. So, you know, a city like Memphis or a city like New York or whatever, their health departments are tied into the hospital systems. Here in Kansas City, this is something this is kind of, you know, you're stepping into our offices a little bit in our conversations. It's around, we've got multiple hospitals. They're all owned or with different affiliations, I should say. And so getting them onto one shared network where we can have that information, that has been something that I think this area has struggled with for decades. And so we're mostly at the mercy of hospitals saying, hey, we'll give you this information. So we are, you know, working to get that information from them. We need them to like steadily send it to us. In order to have that. And I think the honest and unhappy answer is I think it will take a long time.
Okay, I'd like to follow up with you on that, but I appreciate that explanation.
Thank you.
Madam Chair, I just wanted to amplify something that Councilman Reyes stated, that I've been, as you all know, discussing about preparedness for federal changes. And as a finance chair, a lot of other folks are saying that we are behind as a city in terms of our being organized and prepared for federal changes. For example, the United Way has already started to stand up a emergency response system as it relates to responding to critical needs in the social service network. And so I think it is important for us, especially from a funding perspective, that we start to think about how are we going to address funding shortfalls. There was conversation about, from our staff, about monitoring the federal government layoffs and how they're the third biggest employer for the area. And so that's great, but it seems, and we're tweeting different things and saying different things on social media, which is all wonderful, but it doesn't seem as though as a city, as a corporation, we are having all of our departments develop that emergency response or that critical response based on the changes that are happening. So I'm, just stating for the record publicly, based off of what was shared by our colleagues, that it is important that I think that this applies to all of our departments, most of them.
Yeah, I can just add that I know that we are beginning the work to analyze each of our federal programs and work with each department to determine what is the impact to their department. So do they have people? And in the health department's case, that is a big component of their federal grants, is they pay for people and important programs with those. And so the idea is to go through and assess that risk fully. So we are down the road working through that, and we will get with each department to work on exactly what kinds of programs would be potentially at risk and/or positions in that.
And that's really refreshing to hear. Is that just internally, or are we thinking about programs that we fund, like our domestic violence shelters who get federal money as a pass-through, our CDBG folks who are reliant upon us to distribute those funds? So are we thinking how our funds actually impact our overall community?
We will get there. We're first looking kind of inside the house to see what kind of issues we might face as an organization.
Right.
Certainly, I think for a department like housing, they will be looking at CDBG and wanting to notify those subrecipients that there might be some issues with how the grant contract is written, if it has a DEI component or something that we're concerned about.
Okay. Madam Deputy City Manager, it would be amazing to have that in our report that we get from the manager, just kind of a link to share kind of like how we're being organized around this. This is refreshing discussion and will help us to not to have so many things to stay up at night and think about. So a report around that framework would be really great. Thank you.
On that, thank you.
All right. Hey, thank you very much.
Thank you.
All right, thank you. And our final department is General Services.
As they're coming forward, can I just make a recommendation? Or maybe it's in here and I don't see it. If there's departments that are like in multiple sections, like there's like a legend or a cheat sheet that gives us, the breakdown per department?
Yes, we can certainly do that. It should be pretty limited to 2 departments, but we will list that as Public Works and City Manager's Office.
Okay.
Yep.
So fleet is going to be, or not fleet, I'm sorry,
and-
general services is just going to be in one section?
General Services is Finance and Governance and Consolidated, but I think they're going to focus on Finance and Governance today.
Okay.
And then I love the idea, and we can put links in there too.
Okay, that'll be
So
helpful.
we'll do that.
Thank you.
Thank you.
Well, good morning, Madam Chair and members of the council, as well as Deputy City Manager Kamiko Gilmore. Thank you for allowing us the time to talk about general services. To my left here, I have brought with me the financial manager, Jeremy Jackson, and to my right is Deputy Director Cedric Rowan. All right, we are generally part of the Finance and Governance group. And what I have before you is a proposed funding of $61.5 million for operations. You will see also a second sheet that will show our internal service fund support, and it's about $145.6 million, and I'll talk about that later in the conversation or in the presentation. Our current position count is 297 positions with 60 vacancies, a rate of 20%. Majority of vacancies are IT and fleet, which account for 92% of our current vacancies. The department has several key divisions with varied responsibilities. They include facility management, fleet services, real estate and asset management, security, architectural services, information technology, procurement and contracting, risk management, and safety. The metrics that you see before you helps evaluate our operational performance. Our first metric is the percentage of employees that complete our cybersecurity training. Our goal is 100%. It tracks the completion rate required for the cybersecurity training. What it does is it increases the workforce awareness and preparedness against cyber threats. Our second one is availability of critical IT services. Our goal is 99.9, which is the industry standard. It measures the uptime and reliability of essential IT systems that support city operations. The frequency rate and claim count is part of our risk management program, and it monitors our workplace injury rates and associated claims as is compared to the payroll expenditures. The percent of fleet within life cycle, this evaluates the proportion of fleet vehicles and equipment that are within our recommended service life. The goal is 80%, which is in line with industry standard. The percent of fleet availability measures the readiness and availability of our fleet. 75% is optimal for the classification of fleets that we have. And what it does is ensures the department has the necessary resources to deliver services efficiently. The general services allocation increased by $10.4 million, which is about 20% for the upcoming fiscal year, which gives us the 61.5. This increase is primarily due to capital improvement projects and debt service, which accounts for a significant portion of the budget adjustment, and I'll talk more in detail about what those changes are later in the presentation. The internal service fund mentioned earlier, $145.6 million, represents allocated costs for essential services across city departments. It shows an increase of about 11.4%, which is $14.9 million. The key drivers here are city utilities, which costs increased by $2 million, centralization of IT services, and improvement and increased application and software maintenance. I want to just clarify that even with the centralization of IT, many of the positions were pre-existing, and we moved them into a singular unit instead of dispersed across the city. Our risk management is about $1.8 million of this increase. And major changes to the budget, there is a list here, and I'll walk through them and explain kind of what each of them are. The $30,000, this funding will support the integration of mobile technology for the Healthy Homes Inspection Program. The $250,000 is our Drive Cam program. We have about 400 vehicles that have not received the installation of these drive cams. They are in solid waste in the Kansas City Fire Department, and with these resources, we'll be able to outfit the vehicles in these two areas, which will then account for 100% of our vehicles. $185,000 for an energy management program. This is a program that was around probably about 10 years or more ago. It proved to be beneficial, and this program then revives it, and it'll focus on sustainability, cost savings, and environmental responsibility when it comes to energy. $2 million for our backup storage expansion and IT. It increases the capacity for city's data. $500,000 for our Wi-Fi network expansion. It aims to provide reliable and widespread internet access to not only our employees, visitors, and also public in our municipal buildings and areas. $190,000 for our composting program. This will help increase the visual or visibility of our composting program in our municipal buildings. $350,000 for our roof garage windows, one time. This will basically focus on the waterproofing of the windows at the garage. $100,000 for our 1% art conservation. It ensures that our public art installations remain in good condition. $240,000 for the city market sub-metering. This initiative ensures fair and accurate water consumption tracking for our tenants, and it supports sustainability efforts. $1 million for our fleet passenger vehicle charging infrastructure. We have ordered and acquired electric vehicles, and we plan to acquire another 54 vehicles in order to outfit our fleet to support our departments. What these resources does is it allows us to now purchase the infrastructure for which the EV vehicles will operate from. It reduces emissions by pursuing these initiatives, and it supports the city's long-term green transportation goals. The major changes to the budget are decision packages, $5.8 million for Barney Alice Plaza, which will support continued improvements to the area. $1.7 million for the 18th and Vine Garage. This funding addresses the growing demands for parking in the surrounding area. $10 million for our facility improvement. What this does is allows us to continue to make the necessary improvements and critical repairs and upgrades to our city hall. $5.6 million, rounding up, for the fleet vehicle acquisition. What this does is it allows us to replace our aging units and be able to meet our city department operational needs. Okay, our key highlights and accomplishments, ADA, FMLA, and reasonable accommodations have transitioned over to the risk management program. What this transition does is streamline compliance and ensure coordination of employee services. Our REMIS system, which is Risk Management Information System, we have a go-live date of late spring. And what this system does is it's a major step moving forward because it improves data management in these areas. It allows us to streamline processes for handling claims and incidents. We've secured $250,000 in cybersecurity grants, which is going to help with our city data, systems, and networks. The reinvestment of our project savings were used for key renovations. One is the City Hall 8th floor cafeteria remodel, the 8th floor Joanne Collins training room, and updates to the conference rooms behind the 26th floor council chamber. These improvements create better workspaces, enhance collaboration. $50,000 savings from our Lytics drive cam negotiation. The department achieved this, which enhances the safety and monitoring of the city fleet. Cyber insurance savings of $306,000. This was made possible through the effective handling of our previous cyber incident, and it's reduced the perceived risk and in turn lowered our insurance premiums. Our parcels resulting in about $700,000 in surplus revenue, and these properties that were sold: Hodge Park, Tiffany Springs, 65th and Prairie View, 25th and Prospect, and 81st and North Platte Purchase. We procured $6.2 million for vehicle replacement. These are orders that have been placed, which commits us to 56 work trucks out of about 110 scheduled replacement units. The implementation of our procurement intake form was a response to our departments of the need to expedite the request for procurement, and by having this in place, it streamlines and standardizes our request. Upgrade of primary internet connections. We've gone from a 1G to a 1 GB, to a 5 GB to meet the increasing demands of digital operations throughout the city. We've reinstated the cybersecurity training program, and we've also deployed spam and phishing email protection systems, and all of this is to further strengthen our cybersecurity efforts. General services and the programs that we have connected to the citywide business plan under Goal 1G, request from the council is to deliver a uniformed information technology governance framework to establish and improve accountability. We have been working diligently to not only, our first step is to centralize the IT group, but to also put policies in place to help govern how we acquire and manage our IT systems. We have 2 KPIs that help us in navigating whether or not we're moving forward in that direction. One is related to cybersecurity training, and the second is related to our critical IT services. We're at about 99% to date in meeting compliance on the cybersecurity training and 99% for our critical IT services. We've been asked to implement the risk management program in order to mitigate risk. We have proactively implemented the program, and we work very closely with the Risk Management Committee that provides governance for the city. The KPI we have is an audit that is performed, and we just want to make sure that our employees are safe and helping reduce litigation. So our safety audit issues, the percentage resolved in fiscal year '24 was 30%, and this has improved to about 50% to date. Infrastructure and accessibility provide a robust and accessible electric vehicle charging infrastructure for the municipal and also for use in the area. It is in alignment with the zero emission strategy. The 1 million that was mentioned before will help us in achieving this objective. A KPI is we're going to monitor the conversion over to electric vehicles when it's made available. 5B is to provide funding to support maintenance of our assets to keep them at good or better condition. We aim to ensure that the city's infrastructure is maintained. It involves allocating resources to maintain and preserve our existing buildings. At this time, we do not have a number for the industry standard and where all of our buildings stand. Our first step in the process to prepare for the upcoming presentation is to first identify and assure all of the inventory that we have, the assets. Then we will follow with an assessment, and from that, we'll use that in comparison with industry average, and we'll be able to better share with you the conditions of all of our buildings. That concludes my presentation, and I am open for questions.
Councilwoman Robinson.
Thank you so much, Madam Chair. I have two questions. One, there was a slide regarding $10 million for facility deferred maintenance, facility improvements.
Yes.
Okay. What is the deferred maintenance amount on all city-owned buildings?
I will share with you the most recent ones that we've assessed. So some time ago, we assessed our fire stations, and we're already working on that. The next tranche that we looked at was the 18th and Vine buildings in the area, and a summary was provided, and it's upward of close to almost $7 million for those infrastructure items. City Hall, the remaining is about $121 million in order to bring the building up to par. It is an 86-year-old building, so that's about equivalent to any building that's around that age if we have lack of deferred maintenance.
120 million for the city, for
Yes.
City Hall.
Just City Hall.
And this budget represents 10 million.
Yes.
How much, can somebody, in our CIP program, how much is the City Hall building in our community, our capital improvements plan?
The City Hall building, how much do we have for maintenance?
Please don't tell me it's non-existent.
Yeah.
Last year, in the last
No, this year, in this budget, are there any City Hall repairs
Yes.
outside of this 10 million?
Yes.
But the 10 million is in our CIP.
10 million, the 10 million will be debt financed, and it'll be against the new upcoming budget. In the current budget that we received, I'm not sure if that was CIP, but we received about $40 million. Half of it went to the garage, which is under construction.
Okay.
And
Let me ask my question another way. So our CIP program is a 5-year program, right? And so how much is City Hall repairs reflected in our 5-year plan?
You have 500,000 a year for city facilities generally, which would not be City Hall
Yeah, I'm
directly.
pulling
Is
up
that
the
correct?
CIP plan.
What the way the 10 million came about is identified, there were several departments that provided decision packages and said, you know, we need some help in our space, it's not livable for employees, et cetera, et cetera. And so we identified some additional funding available in the Capital Improvements Fund to cover the debt payments for a $10 million financing that we will do next year in fiscal year '26, but start paying for in '27 and beyond, out of the CIP plan. But other than that, I mean, we don't really have, other than the maintenance, unless you've got some.
It is the maintenance in the budget. Yeah, it is the maintenance, and that is really, and that is to the tune of around $6 million collectively out of the CIP plan.
For all city buildings.
All city facilities.
Not
And
just
how many
City Hall.
buildings do we have roughly?
We have over 100 buildings, probably about 110.
And the 120 million is
Fire,
just, I'm sorry,
police.
I apologize.
It includes fire, police. We get about $500,000 for police, $500,000 for fire, and the remaining $6 million. So that includes their buildings also. So it's all city buildings except for aviation, water.
Okay, so we have over 100 buildings. This one requires $120 million worth of deferred maintenance.
Right.
We were able to look under the cushions and find 10 million for 1 year, but that's not in every year. That was just for this year. So my questions are more around how are we planning for especially our City Hall building and others, obviously, but I mean, we should prioritize.
Yeah. No, you're not wrong. We do need to add more funding in the CIP plan for this. It's just that it's a finite source of money. Question 3 in the GO bonds from 2017 was, the goal there was to do more in terms of city buildings that staff occupy. That ended up being money for, I think we financed museum as well as the KC Pet Project building.
Okay.
Primarily with that 50 million allocation from question 3.
Well, I certainly don't want to solve the problem here, but I would love to have more information about like what we're planning for. When does questions 1, 2, and 3 expire? I mean, how many more years do
We have maybe, I think we have a plan in the CIP plan using about $500,000 of question 1 in each of the 5 years of the remaining plan. It's almost done. We've almost issued all of the question 3 money. And so there's none
when
left.
when does it expire? Like,
Well, it expires when it runs out, right? So we have question 1, 2, and 3 money. Question 3, we issued the bulk of that in the early years of the GO program. So in like 2018, 19, in the next 5 years, I think we're doing $500,000 issuances a year for these next 5 years, if I'm remembering it right.
In question 3?
In question 3, yeah, from question 3. I think that's correct.
Question 3, we have $1 million in each of the next 4 years
Oh, we do,
for
okay.
city buildings.
So there's like $4 or $5 million left in that question. That's it.
and
once
after it
it's
runs
gone-
out, do you go back to the voters and ask for more, or?
We probably don't have an opportunity to do that because without a tax increase. We can do it when we get a little farther into the program for GO bonds, but that program just started in 2018, and it'll take 20 years from 2018 for that first debt to start rolling off.
Okay, all right. Well, thank you so much. It's been very helpful, but if you could think about, especially the City Hall building, what the plan is for that. Thank you.
Right. Mayor,
I just
Councilman
have one
Carros?
question, and then I need to go. In regards to the print records management and mail service, you got $2 million, I think, allocated for that. Is that just for one company that you use for that, or is that spread out over some companies, and is there any minority participation in that service?
So there's 2 parts to that. The $2 million is an allocation which we can spend up to based on services that are needed for our departments. So like mailroom, I've got a little over $1 million. If we do not mail a piece of mail, then we will not spend a dime in that $1 million. We estimate that because we believe over the past several years, whatever, that's kind of been what our spend threshold is. The second piece, I think what you're asking is, who do we procure services with? And are we engaging with MBEWB?
Yes.
Okay.
And our current provider for our mailroom operation is Lineage. They operate off of Broadway over here. They're not an MBE or WBE business. Our current printing contractor, KC Blueprint, is a woman-owned business, but not an MBE. So Lineage was previously a company called Strom Automation, and they were sold and took over by a company called Lineage, and they're a medium-sized mail house operation. The lady in the basement is their employee, and she handles all of our incoming mail and outgoing mail and all other packages that come into the building.
Is there any reason why we don't use any MBE, or have we reached out to any MBE participants?
In our previous contracts with the print operation, there were MBE, WBE percentages. On the mailroom operations, quite frankly, I can't recall whether or not it met the criteria to have MBE, WBE participation. I'm not aware of too many MBE, WBE firms who are in the mail operation business. Could be, I'm not aware of them, but we have to check with Creo to see if there's any contract we issue where participation goals should be included. We work with Creo to determine what that is. And all of our suppliers have to be certified and verified by Creo in order to participate in the city contract. So at this point, sir, I would say Lineage is currently not having any participation. They also perform outgoing mail, large mail distributions. Case in point, we don't do too many W-2s anymore, but they do all the processing for our W-2s.
So you seem like you just limited it to mail. What about any other record management that you have? Do you have any other
record management
issues or concerns that is not just geared towards mail?
Well, our record management, no. Right now, our record management storage facility is with Iron Mountain. If you talk about record management.
Yes.
Right. That's all handled by Iron Mountain. They have the caves, which are located off of 63rd Street. But we do have an initiative to be less paper, to be more electronic in our register storage. So right now, our contract is with Iron Mountain. They handle all of our records that are stored, and those records then are disposed of when we reach our retention period based upon the type of record it is.
Okay. I don't want to belabor, I got to run, but I want to have further conversation about that because I got some thoughts I want to share.
Okay. Look forward to it.
Absolutely. Thank you.
Thank you.
Councilman Rea?
I'm sorry, I didn't realize I still had my hand up. I do not have questions.
Okay. Mayor Pro Tem?
Yes, I had questions. Thank you. So I would like to go to page 66 and talk more about fleet. So can you elaborate on your two KPIs regarding fleet, the percent of fleet within life cycle? I'm confused about where it says active equipment only. Can you provide some clarification about that and where we are, what that 57% truly represents?
The active equipment is an exclusion of like lawnmowers or trailers or those type of equipment pieces that are external to the vehicle. So we have over 300 units, 1,000 units, I apologize. It would be nice if we only had 300. We have over 3,000, 2,700 are vehicles. So what this does is focuses on the vehicles.
And the 57% says what? That 57% of the fleet is within life cycle?
Yes.
57% of that 3,000?
Yes.
Or 2,700 is what you're saying?
Yes.
Is within, what's the average life cycle of the fleet? Or, and I assume it's probably different for different pieces of equipment, but what is the average life cycle of our fleet? And what's the average age?
So we use in
Currently right now, as Director McKenzie was saying, our life cycles, it should be about 8 years is what we're looking to try to maintain, 8 years life cycle with the equipment.
Okay, so you try to maintain 8 years.
Mm-hmm.
So that's saying 57% of our life cycle, 57% of that 2,700 are within 8 years. Is that what that KPI says?
58% of the city vehicles will be out of their life cycle, excluding aviation, KCPD, and fire department.
57%, you're absolutely right. But as time goes on, the number that the Deputy Cedric is sharing, Rowan, is as of today. So what the number you're seeing now was as of April 30th, 2024. So now, of course, we have another tranche of vehicles that are out of life cycle.
Right.
So today, we're at, what
Does
number?
it say 58% by the end of this year?
Yeah, are out of life cycle.
58% are out of life cycle.
They're out of life cycle.
Okay, and so your adopted KPI is to have 80%, I'm assuming you mean within the life cycle, right? 80%. And that is the national standard, that's the national benchmark.
Yes, I'm going to take a step back, I'm sorry. As this 57 and 58 is in my head. The KPI that I have before you is within life cycle.
Within.
So in 2024, April, 57% were in life cycle. Our goal is 80% because that's the industry standard. If it was emergency vehicles, you should really be at 90%. So the standard just based on the type of vehicles you have. And we have so many heavy duty trucks that they require for us to be within 80%. So that's what you see here. As of today, we are 58% out of the life cycle. So that leaves 42 within life cycle. So we dropped significantly. Did I get that right?
All right, so do you have a number or a metric that tells us, so what is the cost? What will be the cost for us to actually achieve this 80% within life cycle? As I see the finance director's face drop, what is it going to cost for us to truly accomplish this KPI?
So we've split it.
Yeah, and I might be able to help with what's in your submitted budget. Because this is a delicate, we have been working and heard the direction from both you as well as operational departments, we've got to get this funded. This budget fully replaces everything in all of the departments in the fleet replacement model. So what that looks like is a financing approximately $33 million worth of fleet between various funds in this budget. What that will do, now I will say that excludes business type, water and aviation, because they do their own fleet financing. Also our fire department, because they have their own planning program. And there's a little small category called Friends of the Zoo in our fleet inventory that will let Friends of the Zoo handle their fleet when that comes up. But what this budget does is it finances over a term of, I think, 7 years is what it's modeled at, $33.2 million, getting everything in our fleet replaced that is past its life cycle. And that is a huge investment and something we never want to get in this position again of these peaks and valleys. Peaks and valleys. Looking back, going back, I think around 2008 when the economy first took a hit, is when fleet lost its regular fleet life cycle replacement. So one thing that we are, I think, committed to doing, we're hearing from you, is making sure that we have fleet replaced in this budget. Everything past its life cycle in those funds are included in this debt financing to get this fleet up to date, and then we will have to budget for it every year to make sure we're never out of date again.
Yeah, and I will add to that this is often, we create a plan, and then the economy takes a dip, and then we say, oh, we've got to cut. And so the fleet replacement plan stops. By putting it into debt, then it becomes a first funded item in the budget. We start there. We don't even give any discretion over that. We say, no, we're going to fund that. So that's what keeps it there. The other thing that will help is the priority-based budgeting that you are championing and helping us with, is we will make more educated, informed, and just better decisions from that outcome, I think, as we think about future cuts in budgets. Because before it was, what's easy? Well, you know what? We can make the fleet just limp along. So we just kept making the fleet limp along because we had to cut budgets somewhere. And so we've done a couple things here that I think are going to help us maybe, to Krista's point, not get back in this situation again.
So that is great to hear. And I just want to confirm, because you said 33 million
33.2 million. yes.
across this budget?
It is debt finance.
Okay.
So we're going to be coming forth with you. You will see Kimberly Carter in the Treasury Division saying we need to make this big purchase for fleet for the year, but the debt repayment over those 7 years is built into.
It's built into this.
Yes.
Yeah.
So what is the debt service on a $33 million? Just approximately, like ballpark.
Just, Yolanda, I think you had that number in your slide. It was
Almost 6 million.
around 6 million.
It's like 5.9 or something, I thought I saw.
Yeah.
6 million per year, right?
5 point something.
Yeah, and we'll use our lease purchase vehicle that we have through Bank of America to do that, through finance things over 7,
Right.
8 years, depending on their
There
useful
we go.
life.
Yeah.
Yes. Thank you.
So, oh, go ahead.
Okay, all right, so, yeah, I mean, so that's, I'm glad to know that we are taking this serious. I know that, we've heard from other departments, just, the significant concern in regards to, like, I know solid waste is having to lease equipment where it takes, 38 trucks for them to pick up the trash across the city, 38 trucks a day, and they're having at least 30 because they don't have trucks that work. And I know that leasing those trucks is, we're paying more for those leased trucks. And my understanding also is that even those leased trucks now, they're having challenges there, which leads me to my second question is in regards to the mechanics. Can you talk about, mechanic, understanding maybe there's a concern with mechanics' pay just across the board. I understand, I think KCPD is seeing the same challenges. So is there a request in this budget to increase the mechanic salaries? Or was that a decision package?
Okay, well, from what I am aware of, we have been working with the city manager and his delegate to assist with addressing the salary challenge that we have with our fleet technicians. Is to the point that when we recruit for fleet tech, we may have a couple of individuals that made the list, but they're not qualified to work on the vehicle. May say, hey, look, I worked on the side on my lawnmower, so I'm ready. But they're not ready to handle the trucks that we have in place. The salary challenge that we have was created internally, which is a big concern because employees, I don't know how they know what each other makes, but they do. And with the fire department, emergency fleet techs, which is almost exactly as our senior techs, the currently salary range, I think, is starting 42, whereas my techs start at 22. So whenever there's a list, of course, ours is shallow, and the fire department are able to get, some pretty experienced individuals. The private sector for a position equivalent to that pays about $39 an hour. So it just kind of shows where we fall in the spectrum of pay for that type of service for the techs. We're more than $20 for internally, just in comparable to our fire department, and about $15, $17 from the private sector. So it is a serious problem we need to address. My vacancy rate averages about 30% consistently. The last time I had a full fleet was in 2019, and we had 63 techs, 63 or 64. Today, I have about 38, 39. Mind you, our fleet has grown by many additional units with some of the programmatic changes, like bringing trash collection, bringing solid waste, some of the functions in-house. Well, I used to have 10 techs that supported public works functions of solid waste and snow and those type of activities. I have 4. So, and their fleet has grown by probably about 30%, and I'm doing an estimate there, but we've brought on quite a few trucks. So it creates a challenge. Now, mind you, some of the departments and their vehicle and their equipment has a very high use. It goes through a lot of wear and tear more frequently than maybe a sedan. So these issues with the vehicles that is coming in, and we're having to fix them, and I have less than half of what I used to have to work on the vehicles, then it delays and it takes time in order to return the trucks. I've been collaborating with the Director of Public Works. We actually worked with him to acquire a contract to lease out vehicles so that the city residents didn't feel too much of an impact. They're feeling it. But it could be a lot worse if we didn't open up, and give some flexibility to be able to bring in other vehicles. It is not ideal. Preferably acquiring the necessary vehicles is what's important. The good news that I like to share is that because of the debt financing and the money we're receiving for fleet, we will be acquiring, how many vehicles for Public Works? We will be acquiring vehicles for Public Works, I believe parks.
In this, currently right now, right, about 19.
In the 26th budget. So those new vehicles, the ones that we have on our list today, should help relieve some of the pressure that these programs are experiencing.
Okay, so you've said a lot, but our Director Queen is standing there. Go ahead.
Yeah, so I think this is something we just need to look into. We've discussed it as a group between Director McKenzie, Director Casey, and the Budget Office. And we know that Local 42, in their agreement, got their fleet technicians up to that number that Director McKenzie stated. And we need to likely just match those salaries. And so otherwise, why would you ever apply for what she's got? Why wouldn't you always go to fire, of course? Or you just don't get people who are qualified or what have you. So anyway, I think this is something that we can look into and figure out what's the cost, how many people are we talking about, and overall impact to the budget, and figure that out. And also work with Director Casey on the right way to get that done.
So thank you for that. And I agree. I'm just actually going to ask that we function with a sense of urgency in this, simply because I have significant concern about safety. If you don't have enough technicians, mechanics, whatever you call it, there is a concern about the maintenance checks that need to occur before these vehicles hit the road. And I agree with the Director Queen's statement, but I'll just say, if you know that you can make $20 more an hour going to work for fire, no one would come there. So I'm surprised you even have the staff that you do have and that they haven't moved on. And so I would say let's definitely work with a sense of urgency. And I think just in terms of process overall, as a policymaker standpoint, I know that this body has implemented changes to improve the level of service for our residents over the years with, as you mentioned, the additional, doing the carts, the carts, and it was some other service I was thinking that we've added since then. But one of the things that I don't know has risen to the level of our attention when we make that changes is the impact on your department and the long-term impact of that. And so that's, so I think I would just say as we move forward, as this body makes whatever those recommendations or changes are, as, to try to improve services, that's a component that needs to be added into the docket memos that we receive, added in there so that we can really look at the long-term impact, to make sure that we are giving you the mechanics that you need, because ultimately we're trying to improve the level of service, but we're not successful in that if we don't have all pieces of the puzzle put together. And I will say, we don't. When you have half of the mechanics that you need to allow this fleet to work, there's no way that level of service can be as effective as it can. There's no way that those departments, those external facing departments, can meet their goals that this body outlays for them if you don't have everything that you need. So with that, just to not belabor the point, I would definitely like to make sure that we have, that this body receives an actual plan. And if I need to do it in an ordinance, I'd be happy to do that, to input, or a piece of legislation to task you all to come up with the plan for the mechanics. So I'm looking at the deputy city manager now, because I know I can't technically direct you, but to give us a plan for what you need to increase the mechanic's salary or technician salary, whatever you call that position, to ensure that we achieve parity internally amongst our positions. But also, you clearly need to look outside, because I know, as you've stated, we also are under, we're not competitive when you look at in the private sector either, but we at least need to achieve that parity internally. So I would just like to ask you all to aggressively, to do that with a sense of urgency.
Yeah, I don't think we don't need an ordinance or resolution or anything like that. I've already sent the email, so we're.
Mayor
Okay,
Pro
thank
Tem,
you.
can I
Yeah, sure,
add
go
on that? In your report, can you also identify if we have any certified apprenticeships that are under that classification, so that we can start to build a workforce through our community, so that they can be an apprentice to be a maintenance, whatever the name of the position is? Okay, thanks.
Absolutely. Thank you.
Thank you. I think everybody gets that, this fleet issue is a concern for me. If I can be supportive, please let me know. So the final thing that I want to talk about is procurement. Frequently, this body, my office, we receive concern about the procurement process, and, sometimes the significant delays in the process. And so I wonder if there are any, if there's a request or recommendation in the budget that will allow the procurement process to be more efficient, to be more streamlined. I don't know if there's technology, or, if you need additional staff. What are the challenges that you're having, and are they addressed in this budget?
They are not addressed in this current budget. It is a issue that we've been working on diligently. And one of the recommendations, or one of the solutions we put in place, but there are so many more that need to occur, is we put in an intake program, which allows individuals to submit requests where requests used to come word of mouth or via email. So now we're trying to streamline that. There needs to be training. We do need additional procurement positions. For example, there's gap in knowledge in some of the areas, whereas we only have one single person that maybe handles all technology requests. So when you have those limited resources, it can create a bottleneck. But in this current budget, we did not submit a decision package for procurement. And sitting to my right, I hate to put you on the spot here, is the former chief procurement officer. Would you like to add a comment?
Well, I think Director had mentioned, to be frank, Councilwoman, we hear that quite frankly, but obviously there are some steps that have to be done by the end user group in order for us to be efficient. So I think it's all the way around. The new intake process is designed, and we're going to be doing some more training on that to help streamline so customers understand exactly what we need to be more efficient. The current staff is working diligently, as the Director mentioned, and also we're going to be looking at different processes to expedite types of our procurements. Do we really need to do a full-blown solicitation? Are there other routes we can choose to purchase from? We're allowed to use cooperative agreements that have been publicly solicited. As long as those entities have met the requirements, then we can go direct to purchase versus trying to do a full-fledged solicitation, analyze it, training the new staff. We had a tremendous amount of turnover with the early retirement. We lost a tremendous amount of institutional knowledge. Our new procurement staff is coming on board, learning the processes, as well across the city as well. So to Director's point, the technology area is probably one of our most growing areas of procurement. Our traditional brick and mortar process is pretty much stable. I think it's when we're challenged when we're moving into some of the new areas. I won't call them new areas, but more procurements in the area of technology and services. So we've asked the staff to be more creative, but we want to make sure we work within the confines of our Chapter 3. Since we are a public institution, we have to follow certain, state procurement guidelines. But I'm hopeful that in the future, if we're make the improvements we're looking for, if we don't have it in this budget, we'll sure have it in the next budget. We could come with additional headcount as really necessary. We want to be sure that when we do add headcount, that we can keep them forever and be able to make those process improvements. So any of those feedback you hear, I would love to hear what the issues may be with individuals, and we'll tackle those one by one to try to get the problem solved.
So thank you for that explanation. Do you have KPIs that you?
Yeah, the new intake process was set up to allow us to keep establish those KPIs. Right now, we're trying to work within maybe, let's say, a 4-week window, 2 weeks to receive the intake form. Do we need to go to a full solicitation, or is a contract existing and we can award it? So let's say a 4-week window is trying to establish need to completion. I will tell you that not everything will fit in that window because you may have to do a solicitation that could take longer. But the 2-week window is to get the intake in, get a response back to the end user, and then the procurement officer can say, hey, we can get this done, and now we have a contract available. We can just order it. You can use the PO requisition process. As we get more data from our intake, we'll be able to establish a more clear, concise one. But we try to operate, as I said initially, within 2 weeks from response and intake, get back to the end user. We've got everything we need. We're going to go to solicitation. And then from there, we can build a reasonable timeline to execute what is needed. Been doing it a long time, and everyone wants it now. But I've often said this since I walked in the building: it's better to do it right up front than wait till we get it in and have a whole bunch of issues. And rushing to completion sometimes can cause us more problems. So we want to be mindful of quality of work along with efficiency, so that we don't have issues from our procurement process.
I definitely am not advocating for, for reducing the quality of the work, nor am I advocating for, breaking any, statutory laws or rules. Definitely want to make sure, because, this is taxpayer money, so we want to make sure that we're being fiscally responsible with taxpayer funds. But I also know that we receive a significant number of complaints just about the length of time and the delays, and as a council person who is wanting to, see action, see things move forward, sometimes, it seems like projects, may take, an extra 3 or 4 months that don't really make sense. And so, because also our constituents are wanting action, they're wanting to see movement as well. So I guess, I know I'm not trying to solve this today, but just the thought comes to my mind as the council made recommendations on changes through our planning department, and they established a concierge service. I wonder, because you mentioned the end user, if a potential concierge service may be beneficial for some of those groups or individuals that maybe are having challenges with our procurement processes. But I will just end with a comment that I think, where there are opportunities, it sounds like you're looking at maybe other technology implementation that you can, or technology that you can implement as those things arise. If there's any policy decisions that we can make that will provide better assistance or allow you to streamline, please be sure to reach out, let us know that. And I would just encourage you all to really work with intention on the procurement processes to ensure that, we move things as expeditiously as possible. Thank you.
Absolutely. We hear you, and we will.
Thank you.
All right. Are there any other questions? All right. Thank you very much for your time. This concludes our joint budget meetings. Thank you all for your participation.
Thank you.
And
Thank you
to
for your
staff.
time.
Great job, Madam Chair, and to the
Yes.
staff.